strengthening social infrastructure, which includes things like parks and libraries, as well as public programs. The sixth strategy is the one to create a culture of connection. Today's online event, which is being recorded, is all about strengthening our social infrastructure and creating a culture of connection. We thank all of our speakers today. We thank TCTV for recording all the segments and for sharing it on a variety of platforms. Timberland Regional Library will be uploading the segments on our YouTube channel, and we will share it out in our monthly e-newsletter in June that goes to over 90,000 people in the region. Timberland Regional Library staff have created a resource list on books for kids and teens and families about mental health and additional online resources at trl.org. Click on the top banner for this event, which will take you to the landing page about the event and all the resources. Take it away, Lori.
Thank you, Cheryl. So first, we're going to have a land acknowledgement. I would like to acknowledge, acknowledge and recognize that we are on the traditional homelands of the Southern Salish Sea peoples. Let this acknowledgement be an expression of our deepest respect for Indigenous movements, sovereignty, and self-determination, to express gratitude for their enduring care and protection of these lands and waterways. May we all work together to be good stewards of our world. We acknowledge our presence on the traditional lands since time immemorial of the following tribes: Squaxin, Nisqually, and Chehalis. And I would now like to welcome Commissioner Carolina Mejia from District 1 of Thurston County. Commissioner Mejia was born in Progreso, Honduras. She is the daughter of a medical doctor and a nonprofit advocate and educator. Throughout her life, Carolina's parents have demonstrated the importance of caring and advocating for disadvantaged community members. At the age of 11, her family moved to a small rural community in Shelbyville, Tennessee. In 2013, Carolina graduated from Christian Brothers University, where she obtained a Bachelor of Arts in Business Administration with a minor in pre-law. Shortly after graduating, she permanently relocated to Washington State to continue her post-secondary education. She went to law school at Bean and worked at Bean Porter Hawkins LLC, a law firm specializing in immigration and personal injury. Carolina has taken to volunteering and advocacy in her new community here in the Pacific Northwest. While her community has changed from place to place over the years, Carolina has remained committed to serving diverse and underprivileged communities. Her education, personal experiences, and professional background have taught her valuable lessons that are instrumental in guiding her work. She has a strong desire to serve our community and enhance its richness and diversity. In 2021, Carolina was elected to the Thurston County Board of County Commissioners. She was elected chair in 2022 and continues to serve as the chair this year. She's also a member of the Board of Health. I would now like to turn it over to Carolina and welcome Carolina Mejia for our keynote address.
Thank you. Can you hear me all right? Okay, I think if something does not scream COVID, it's technological issues, you're on mute, everything. So it's completely understandable. But good morning, and Lori, thank you so much for that wonderful introduction. I really am so honored to be joining you today. I'm also so excited because we need to continue having these conversations. They're so important, they need to be accessible, and they need to be understood. Until recently, and even still, talking about mental health, especially in communities of color, is seen as taboo. Don't talk about it. If we don't talk about it, if we don't acknowledge it, then it doesn't exist. A mental health crisis can be solved by just pray, mijo, and you'll feel better. Or you're just being lazy, go do something and that feeling will go away. Or they're not a good mother. They have gone complacent and they just want to sleep all day. It really is embarrassing, something you feel like you have to cover up so they don't talk about you, so they don't judge you. Many of those families end up struggling on their own. They cut themselves away from the community and exile themselves. And they struggle to find resources for help. They don't know who to turn to. They don't know who to call. And if they call, it's usually 911 because it's reached a breaking point, at times a point of no return. Communities of color, marginalized community, have a distrust towards the system because the system really has a distrust towards them. So many end up getting lost looking for resources. They become simply a statistic in an agency's book because this system we have set up is confusing and frustrating for providers. Yet sometimes we expect for people to jump through invisible hurdles without telling them the obstacles they need to overcome. Many end up leaving disappointed. They end up trying to find other solutions. Many succumb and isolate themselves, and many turn to substance to quiet the pain. I tell you all this because this has been my family's experience. I feel as a government employee myself, I should know the system, yet I myself have gone lost so many times within it. As I looked through the information and the data in Thurston County, it was honestly harrowing and that sometimes seemed very bleak. While many of us are still coming down from the aftershock of COVID, I saw a video the other day where I realized I really haven't truly processed the last couple of years. But COVID provided us an opportunity to see how short our shortcomings truly were. That while we thought we had an area of our population covered, marginalized communities were the ones to carry the strong impact in that gap. Families had to readapt and children were placed in difficult situations. Our communities lived and experienced how the pandemic made it difficult for everyone due to the isolation, the stress and anxiety, and not knowing if you could lose your job, but also one of your friends or family members. We are now paying the price for those shortcomings by trying to address the now, but also trying to address future needs. But the reality of the situation is we are not only in the crisis because mental health and substance abuse has increased in our communities, but our system is so overwhelmed across the board, from our hospitals to our justice systems, to our houselessness networks, to our nonprofits, to even our coroner. Washington is experiencing a shortage of providers in general across the board. Based on population, there is only one mental health provider for every 360 people. We as a state have one of the highest rates of individuals struggling with mental health and addiction problems in the country, but we don't have nearly enough mental health professionals to help us address the matter, to give case management, to give follow-up. Adults in Thurston County experienced a significant increase in the average number of mentally unhealthy days between 2019 and 2020. To put this in perspective, in 2019, the average number of mentally unhealthy days in the preceding 30 days reported by Thurston County residents was 4.3 compared to the state average of 4.4 and the national average of 4.5. In 2020, the average number of mentally unhealthy days in the preceding 30 days reported by Thurston County residents was 5.4 compared to the state average of 4.5 days and the national average of 4.4 days. But it makes sense to me. So many people lost their jobs during the pandemic. The current unemployment rate in Thurston County, for example, is 4.7%. Thurston County has seen an increase in housing by 36% since 2017. With increased housing prices, it has led to increased houselessness and increased stressors and instability. In 2022, the point in time count reported that there were around 766 people experiencing houselessness. Out of those 766 individuals, 239 reported having a mental illness, 174 a physical disability, 202 a chronic health condition, and 123 suffered from substance abuse, and 72 had a developmental disability. In Thurston and Mason counties, 31% of individuals with disabilities lost their job during the pandemic. While many of those have returned, 10% of the people have not. Both their confidence and safety in the work environment were compromised, and for many, the fear of COVID-19 remains. Our communities are facing an intellectual or developmental disability face multiple health risks that prevent them from returning to employment and social gatherings. Even though they need those interactions as much as anyone else. Our specialized recreation program was closed for nearly 3 years, which further has isolated people. As our programs start to return, so do the people, but with more caution than ever before. Now, an issue that is very near and dear to my heart is maternal mental health and maternal mortality. Again, we see that healthcare provider shortages, including OB care, create challenges, which means increased number of pregnant individuals are either late to receive care or not getting prenatal care at all. And if you're uninsured or have Medicaid, if you're Black or Latino, or you have an increased rate of maternal morbidity and mortality. The hard reality is that the US continues to have the highest maternal death rates amongst the other developed countries, with a staggering 32.9 maternal deaths per 100,000 live births. 80% of these deaths are preventable. There are several contributing factors for maternal deaths. Mental health conditions, more specifically suicide, is the leading factor, accounting for 23% of all maternal deaths. Well, we've covered the adult section. Children were just as impacted by COVID, by the isolation. 8th and 10th graders were surveyed and reported feeling sad, hopeless. They reported feeling nervous or anxious, unable to stop or control worrying, considered attempting suicide and had attempted suicide. 8th graders saw an increase of 4% in 2021, from 33% in 2018 to 37% in 2021. And for 10th graders, the increase was from 40% in 2018 to 41% in 2021. Those numbers increased in females, LGBTQIA+ kids, kids with disabilities, or kids who are Native American, Alaska Native, Native Hawaiian, or other Pacific Islander and Hispanic or Latino. So what is the after effect of this? Substance use for 8th graders in 2021 was 48% for illegal drugs. Alcohol use for 6th and 8th and 10th graders in 2021 was more than 40%. And we're hearing this on the Board of Health, on the Board of County Commissioners, and in our community. After all of this, I know it seems quite a downer, but I'm still hopeful because we have been given this opportunity to address these matters, not in silos, but as a community. More than ever, I have seen different groups, nonprofits, private sectors, governmental agencies, and our tribal sovereign partners come together. Do you know how amazing that is? Instead of everyone pulling in different directions, there's a mutual understanding that we have to pull together. That while we all want to see immediate solutions, we want long-lasting solutions more. Weak foundations have led us to where we are today. This is the reason why we are here. We need to build a strong foundation. We have learned that we can't keep pushing an issue down the road, and that while we might not all agree, we need to learn to trust each other. The struggle from resources still remains. There really just isn't enough funding for what we need. So we need to keep having these conversations. We need to keep bringing these issues to the forefront. Thurston County has implemented the LEAD program, the Law Enforcement Assisted Diversion and Recovery Navigator programs that focus on community-based case management and alternatives to jail and prosecution. These programs allow participants, neighborhoods, community services, police, and prosecutors to work together to ensure that individuals who have unmet needs because of substance use, mental health issues, or extreme poverty receive the help they need to address problems they are facing. The Regional Housing Council is also working on solutions for our housing crisis in Thurston County. And the county passed a home fund last year that gives us around $8 million to help address this. If we really start trusting each other, maybe then our communities can start trusting us. When I had my first daughter, I often got told it takes a village. I truly believe that in order to address these issues, it really will take all of us. To just end this, I really wanted to give our thanks to our public health and social services team. They've had a rough couple of years as they dealt with the COVID pandemic, and now as everyone tries to switch back to normalcy, they dropped everything now and they're just trying to pick up the pieces. So thank you. I am, again, very honored to be here today.
Thank you so much, Commissioner Mejia. What an inspiring speech. Wow. Thank you. I'm so glad we got to record that. All right. So I would now like to introduce our panelists. We are going to be having several panelists, as you can see, they're pinned up there. So I'd like to welcome and thank our panelists for showing up today. I'd like to introduce Tanikka Watford of the More Right Group, Carrie Mayeux of Community Youth Services. I hope I got that right. JP Anderson of Choice Regional Health, Shelley Willis of Family Education and Support Services, and Sarah Ellsworth of True North at ESD 113. And somebody asked, what does that stand for? It's Educational Service District 113, and we serve 44 school districts in the capital region, the 5 counties. So I'd like to welcome all of our panelists today. And again, since I don't have I'm not able to access my PowerPoint, I'm just going to read it to you. Our topic today is behavioral, mental, and social emotional health in our rural communities. And so I'm going to moderate this. I've got a few questions that I'd like to ask our panelists. And I'm just going to say whoever wants to popcorn this can just jump in. We've only got a few questions. And so here we go. We are all trying to move forward from the pandemic. What work are you engaged in around this and why? Shelley.
I'm happy to jump in. We're working on resilience, bringing down stress, anxiety, and increasing access to concrete goods, supports, and services. It's all about building resilience, hope, and access.
Thank you. Sarah?
In a lot of the same ways. So just to give a little context, because I'm not sure how much people know about the organizations that we work with or the work that we do. So like Lori said, I work for Educational Service District 113. We serve 44 school districts in one tribal compact school, about 77,000 students across our region in 5 counties. There are 9 ESDs across the state that support all of the public school districts across the state. And I say that because one of the things that we're doing that I'm really excited about, and in light of what Commissioner Mejia was sharing, is that there are not enough providers to meet the social, emotional, and mental health needs of the youth and the youth in our schools. And so one of the things that we are doing is focused on prevention and early intervention for both mental health and substance use. We have a partnership across the 9 ESDs, what we call our AESD network, that added 55 student assistance professionals across the state in 55 different districts to provide prevention messaging around mental health promotion, substance use prevention, and also early intervention for students who are showing signs of potential substance misuse or potential mental health issues. We use a model where we rely heavily on group intervention. So if you are familiar with schools, they work in a tiered framework. These are really tier 2 type services, small group interventions. And the outcomes from that are really, really promising. And we're very excited. That was funded with ESSER dollars. I don't know how much people know about ESSER, but they're COVID relief dollars that were provided to schools and other organizations in response to COVID. ESSER funding ended or will be ending at the end of this year, but we have been funded for another year of this work because of the need and also the outcomes and impact that we're having across the state. So that's really exciting. And again, our goal is to reach kids before they get exceptionally sick, before their mental illness or their substance use progresses to the point that they need significant treatment. and mitigate those early responses, and also free up our providers to serve those who are most in need.
My name is JP Anderson, and I'm the CEO here at Choice CPAA. Choice has been around for about 95 years doing community health improvement projects in our region, and CPAA, Cascade Pacific Action Alliance, is the accountable community of health for a 7-county region, which includes Thurston, Mason, Grays Harbor, Pacific, Wahkiakum, Cowlitz, and Lewis. And we're also honored to serve 7 tribal nations in our region: the Chehalis, Squaxin Island, Shoalwater Bay, Cowlitz, Nisqually, Skokomish, and Quinault. Our organization is doing some work right now in regards to COVID. We're working with some great partners, including some of the folks on this call, to deliver vaccines and vaccine information into our communities, particularly communities that have been marginalized in the past and didn't have access, as was evident as the pandemic started, to the medical care that many did enjoy. We're also doing a project with the State Department of Health, as other accountable communities of health are, which is called Care Connect. And what we're doing with that is working with our existing structure and network of community health workers in the 7-county and 7 tribal regions to provide rental assistance, food support, and all the things people need if they need to safely isolate and quarantine. That program is going to go for 1 more year, and it's actually expanding not just for folks who are needing to isolate and quarantine in that 2-week period, but who are COVID impacted and may have other impacts of COVID, like long COVID or other longer term impacts of that. And so there's some very concrete things here in the next year. Our vaccine work will wind down by the end of the year. But what I'm really excited about and thinking about just that tremendous speech this morning from Commissioner Mejia is the community hub work that we're hoping to build with the new Medicaid waiver. Healthcare Authority will be announcing a new Medicaid waiver by the end of June, and those dollars are intended primarily for us to build a network using that community-based workforce to provide those services and coordinate that care in communities, and for us to build a system where we can take those dollars from DOH and other funders and make them very accessible to community-based organizations, so that we can do the administrative portion, and we can really empower communities to do all the good work of connecting, identifying folks, and doing work around social determinants of health. Ideally, what that ultimately does is start to move that trend of healthcare dollars, focusing them upstream to provide services that provide better health outcomes and wellness, not just response to illness. So really excited to be here. What a tremendous opportunity to join this panel, and excited to talk more about our work.
Thank you. Okay, so do we have someone else? Carrie, would you like to answer that question as well?
I see Tanikka's, I would, and I see Tanikka's mic was
Oh, I
turned on before
apologize.
mine.
Okay.
No, it's great.
Okay.
I'm happy to go after her.
Either
Yeah.
way. So I am Tanikka Watford. I'm the executive director of the Moriah Group. The Moriah Group has done a lot of changes since COVID. We ourselves at our core are a distribution organization, and we are a disaster distribution center. So COVID changed us and expanded a lot of our services and offerings to partners a lot, even our location. So we started out in Thurston County. We are now located in Grays Harbor County, but we still we service the state. Organizations and agencies. We work with about 485 school districts, agencies, organizations throughout the state of Washington. We touch some other states as well, but we service around disaster goods and services and things. So we have a lot of families who've been impacted. So we distribute food and food boxes, but at our core, we distribute items. We have a lot of families who've experienced houselessness and unemployment because of COVID and this pandemic. So we work directly with organizations and families to distribute items, but we also ourselves have expanded some of our offerings to do direct assessments for families who kind of fall in a gap that they might not have in the direct organization that they fell in line with, right? So we might do some assessments and work with our peers and our staff and our specialists to be able to help them to be able to gain resources and know who to go to work with. We also are built up our workforce development that we kind of changed over during COVID to bring it online because we understand that people couldn't go to places. So we're excited this year to be able to come back in person with our workforce development around warehousing and logistics to give people training and expertise around warehousing and logistics and so they can obtain employment. Right. So we also work in recovery space to have open spaces for those who are in the process of recovery. We have a recovery cafe that is a conduit in space for those who have a history of addiction, who are now in the process of recovery, to keep them with the steps and knowing that there's support. Like Shelley mentioned earlier, I guess our word is thriving. We are helping to work to build communities where everyone can thrive. We understand that there are so many needs and so many levels, from mental health to substance disorders, and we added on top of that a pandemic, right? So we understand that we have to partner and work with a lot of different organizations and kind of pull each other up to be able to support our communities on a broader scale. So that's what we've been doing.
Thank you so much, Tanikka. And Carrie?
Yeah, I'd love to go. I love being in this space, and it's really nice being here with you also. Thank you for that. I am the clinical program director of the Transitional Age Youth Program in Mason and Thurston counties, and I'm here from Community Youth Services. One of the things that we're focused on is transformational relationships versus transactional relationships through our leadership, developing talent in our workforce, and intentional community engagement and connection. Community Youth Services shifted dramatically during COVID as well. In listening to what Tanikka was sharing, new leadership emerged during this time. And we're really working to be the best community partners possible and champions of community connection. We're also looking into how we can lead and develop leadership. It's been a time of truth-telling, accountability, and looking for each other's humanity. It was really interesting seeing people's cats, dogs, and kids during this time. And it feels like we got to see multidimensional pieces of people. And then, as many of you know, Wraparound with Intensive Services, or WISE, was an ask from foster youth in the community and resulted in a settlement from Washington State. It's a statewide entitlement and a radical way of interacting with youth and families. We're joining with and not doing for it. Super powerful. Happy to be here with you all today.
Okay, so the second question that we have, and this anyone can jump in, what can people do in the community to help connect with each other in meaningful ways, either in person or virtually, as we come out of this this COVID pandemic? How can people connect with each other? I know that's a difficult one for a lot of us. Do you have any advice you can give them? Sarah?
I'll start, and I think that is so important. And we started this conversation with referencing Dr. Murthy, who has talked about the loneliness epidemic within our communities that has only been exacerbated by COVID. And so I do think that that's one of the things that has been really in front of our faces, is the importance of community and what happens when we have a loss of community. I think there are lots of ways that our world has been transformed and created opportunities for community. One of the things that we have tried to do over this past year is offer opportunities for parents and caregivers to engage in opportunities for learning about supporting youth with mental health issues. We're offering QPR and youth mental health first aid on an almost monthly basis. So it's an opportunity to come together with other members of the community and learn more about youth mental health issues and how to intervene when and if a young person is exhibiting signs or symptoms of a mental health issue. And so again, I think that we've seen this explosion. I know Shelley is offering that through FES as well, and other people have similar opportunities. NAMI has a lot of opportunities, but just finding things that you're passionate about, finding things that you care about. I'm assuming everyone is here because they care about youth mental health and how we do move forward together. And so finding opportunities that exist in your community where you can learn more, where you can connect with other people who are interested in the same things as you. And engage, ask questions, share your story. I think that that's so powerful.
Indeed it is. Thank you. Shelley, did you want to add something to that?
Well, you know me, Lori, I always do. Thank you, Sarah. I think you really said it quite well, that this post-COVID age has brought forward some anxiety and stress. And I'm really glad to see QPR being offered across the county. And I thank Choice for all they've done to help make that happen as well. And I also have seen our child abuse rates in danger here. And I just want to encourage folks, when you see someone struggling in the store with their kids, to be kind. And I know at our office, we're focusing on good intent, looking for the good intent in people and trying to find the positive and offer support to all that we see. It's all about promoting resilience within ourselves and with our community. Strong families equal stronger communities. Thanks, Lori.
Absolutely. Carrie?
Yeah, I love this question. I feel like COVID slowed things down pretty dramatically, and it gave us a really good chance to lean into relationships more intentionally, knowing who we are, what our values are, why we want to connect, our expectations and connection. So back to like what Sarah was saying, like knowing yourself and finding your community. I think we've all really been able to get a better look at, like, the veil has been lifted on a lot of different things, and I feel like we're in a very different place than we were in 2019, 2020. And there are a lot of innovations and creativity and ways to connect as well. So being able to do hybrid or telehealth or in person, like really finding the things that feed you and give you energy, and noticing what isn't serving you as well, and knowing that there are lots of different ways to connect.
Great, thank you so much. JP, I saw that you'd come off mute.
Could you tell I was trying to get in there? Thank you, Lori. You know, I just think this is such a amazing time when we to think about how human connections, our connections with each other, impacts our health, and how we're starting to really identify evidence of that, and to invest in built environments and systems that support more human connection. We have, for folks that are in Lewis, Grace Harbor, or in Mason counties, we have what have just started as blue zones. And blue zones activation is really about looking at the systems of food that exist. There's an element of how those, you know, how you eat and how that impacts your health. But what I'm really excited about is how people in those communities, and potentially others going forward, can work with policymakers around the built environment and build cities and communities that are designed to bring people together through, you know, walking paths, biking paths, places where folks can convene, and using, you know, as it was supported by our boards of directors, we have 2 at Choice and CPAA, using some of the funds that were earned from the last waiver to invest in this, because we see, and healthcare leaders can see, that the human connection is not the fluff on the sides of wellness and health. It is right at the core of it. And so I think that for people in those communities, getting involved with those Blue Zones projects that are getting started up, there will be groups that are walking, that are designing, you know, how are we going to bring more fresh food to locally centralized places where people can enjoy it together? What do we want for our community? So that we are healthier, and that human connection is central to that. And it's really going to be central to the hub work we're doing, and to everything we're trying to promote. Because when we think about the community health worker workforce, what the magic of that is that one-on-one time with someone that's helping and someone that's receiving help. And so I think that, yeah, Sarah, you said it so well and eloquently around all the ways people can do that, but finding those places. And if you need help finding one, you know, reaching out to someone, and really leaning in and trying to make that connection, because it's not the side peripheral part of health. It's the central driving force in our health outcomes.
Very well put. And I'd love to learn more about those blue zones. I would love to know if any of, I know we haven't gotten to Tanikka yet. I do want to ask Tanikka. But before that, if all of the panelists would not mind providing any links or flyers or information on any of these things that you've mentioned, so that we can get these out to our community, I think it would be greatly appreciated by all of those on the call. So if you happen to have links to any of those things, or more information about those items like the blue zone, I think it would be a great way to direct our attendees to find those things. Yeah.
And Lori, if we have flyers, we can't share in the chat because that only goes to hosts. And I'm not sure how to share flyers within the Q&A. If we send those to you, do you have a distribution list?
Yes,
Okay.
I do. And I was going to mention that I have a distribution list of all the participants. And so if you just all send that information to me, I'll make sure that everybody gets that. Tanikka, would you like to answer that question? What can people do to connect post-COVID or almost post-COVID in meaningful ways, either in person or virtually?
I can. So I was going to mention two things in that. One, I find that intentionality has been a thing, right? For us, especially, that even though we are very much so an organization that now services a large reach, we've been super intentional about how do we meet everyone where they are, and having people internally with us who can meet people where they are. But also realizing that there are still immense gaps, right? The gaps existed before. We have learned a lot about literacy issues, even for adults in our community, that it is well that we bring out flyers and kits and things. But if people can't read it, what do we do there? And being super intentional about getting that information to people. And we understand that sometimes it's not always a large group of people, and it might take a little more time than we anticipated to get that information out. And also, I'll mention the second item is being intentional with cultures, right? That I am an African-American woman, and I stand out a lot in certain sects in certain areas. But when we plan and we look towards certain situations and reaching out and being intentional, even online services, assuming that everybody's school system and everybody's community functions the same, and they are far different. But how do we be intentional, not just to make sure that people connect online, having the times that we meet for certain things, having to structure a lot differently outside of how and how we even speak to people and families and so forth. As Shelley mentioned before, I think Sarah mentioned too about the abuse and how do we handle people in those situations and outside of it. I feel that my keyword going back to is being intentional and taking the time in it because people deserve it.
Thank you for mentioning the cultural aspect of that too. And that is something that I know the Educational Service District 113 and all the work that we are all involved in here today is on justice, equity, diversity, and inclusion. And I think we need to keep that in mind as we go forward. So thank you for sharing that. Thank you to all of our panelists. I know we kind of ran out of time, but I especially want to thank all of the 5 panelists for being here today and providing their insights, which are amazing. It's so good to hear from others that we're not crazy. We are all going through this together. And I very much appreciate you all being here. Thank you so much. I'm going to turn it over to Cheryl in just a second, but I'd like to share my screen so that Cheryl can kind of go over all of this next section with you.
So as you can see on the screen, we have breakout sessions coming up, and the first one's from it'll be about 9:48 to 10:30. And what you'll do is you'll select one of those rooms. Well, you'll go into the second Zoom link that will be provided to you, and then you select the room that you want to go into. TCTV will be filming each one of these rooms in case you are interested in the other topics. We will then take a 15-minute break. Just stay on that same Zoom link, and then we're going to come back at 10:45 for the second breakout session, which is a repeat of what you see on your screen from room 1 through room 6, which are the topics that I mentioned at the outset of the event. And so, as you can see, breakout topics are identical for both sessions. and participants may select another topic for the second session. And of course, you can listen to the other ones after TCTV records them as well.
And rethinking of what our systems look like, our structures look like, to move forward in a different way. And I feel like our communities are just trying as rapidly as possible to get back to the status quo and get back to the way things were. And I do think it's at the detriment of our youth and our communities and the structure. And just thinking about that none of us escape this without some level of trauma. One, naming that for people, I think, is really important. And then two, where are our opportunities, like you said, to tell our stories, to have these connections, to talk about what we've been through and have some of that reimagining, because, in different levels of impact, certainly, but none of us, again, are coming out of this unscathed. None of us are comfortable quite with social relationships yet. I think when I'm in the community, people's tolerance is just really low right now. And, when you look at that list, those are what we're seeing. And I think we as adults are models for our youth. And so when I see how dysregulated we are, I'm very concerned about the regulation of our youth.
Absolutely. Thank you for that. And you all really touched on some things that could help. So yeah, acknowledging what we lived through is something that we're still learning about, and a lot of us are still in. It is a collective trauma. We're having to explore new ways to find purpose and meaning, both as ourselves and our families and our communities. We talked about it on the panel, but like building that creativity and self-awareness around your connection needs. So finding like what feeds you, what zaps your energy, leaning in and learning more, and really paying attention to that. I think there is a want, because of the trauma of the last number of years, just to like, okay, that part's over, like now I'm going to begin. And really there's a lot of restructuring and rebuilding that needs to happen. And hopefully it's not a lost opportunity like what you're talking about, Sarah, and we can learn from these last 3 years and rebuild some of those systems, rebuild some of those structures in a way that really serve everyone and not just the people that are designed to have the most privilege and gain the most from it. So just some other ideas of ways of things that can help with traumatic stress and anxiety. And I really was thinking of, especially with transitional age youth, like Mara thinking about like the 15-year-old, like 3 years ago, being like, it's just, yeah, it's incredible. I have a 3-year-old, so she was 4 months old when things locked down, and knowing that like at daycare, like there were not faces to be seen. Like it was lovely those 2 months where daycare was shut down. It was lovely for us because we got to spend so much time together as a family. It was terrifying at the same time, but just like having like the hallways weren't safe, having to drop her off and just basically hand over this baby in a hallway and then go to work. Like it just was like the things that we did to maintain our lives. I think really being able to slow down and look at those things. What things do we want to hold on to? What things do we want to let go of, and why? Like, how do they serve us? How do they serve all of us? And how do we elevate everyone's voices? So in talking about regulation, this model is something that our program has really utilized. So Lisa Ferenz, I linked, so in our chat, I linked you to this Canva, basically PowerPoint, and then to a number of different sites to explore. And her site is an endless goldmine of support and research. And this is one of the things that we go back to and back to and back to, especially in working with transitional age youth. So there's this loop of self-destructive behaviors. And so knowing that this is not, this is the typical way of really looping through different negative interactions, and that we have the opportunity to shift that. So the CARES model goes through and gives very specific actions to take before getting into risky behavior. And we know that risk looks different for all kinds of different people. For some, it's self-harm. For others, it really is meant to be a very expansive way to use this. I don't know if you all know the brain flipping, and I'm trying to remember the person's name that does that, but like we know that it takes 90 minutes to re-regulate the brain so that we have access to that full brain. And one of the amazing things about the CARES model is that it re-regulates, it incorporates both hemispheres of the brain and reinforces self-efficacy. So in times where we always want to increase natural support, we call natural supports, and being able to reach out to friends, family, neighbors, as well as those informal system supports, being able to really have those skills in any environment, in any time of day, any season, can build that empowerment. And so that's another thing that we really love about this model. Have any of you heard of this before or utilized this before or anything like it? Oh, there's something in the chat. Thank you, thank you, thank you. Yes, Dan Siegel, flipping your lid. Thanks. Lots of really good videos of like him explaining it. It's fascinating, especially having a 3-year-old. So CA in the CARES model stands for communicate alternatively. So the idea is to use 2 different skills for 15 minutes each to really start to regulate your brain. So alternative ways, visually, orally, through language, and hopefully what this does is that re-regulation can feel so far away, but by doing 2 skills for 15 minutes and then checking back in and moving to the next part of the model, it can really start to feel empowering. And what we hear a lot of times when people are starting is, I don't believe this is really going to work. This doesn't seem like enough, but practicing when things are going well, really utilizing this and figuring out what works and doing some self-monitoring before, during, and after can be really helpful to help people build that capacity and that skill set. And this is really meant to be a question and answer session. So if things come up, I just know that you all had asked to go through this. The middle stands for release endorphins. And so 2 skills for 15 minutes each. So running up and down stairs, doing jumping jacks, belly laughs. We talk about pre-approved TV and movies when we're working with our youth, so that we're not re-triggering or kind of restarting that clock of having to go back where we're escalating or getting more agitated. But the idea when safety planning especially is to really try and think of things that no matter where or when someone is, to be able to have a range of skill sets that they can use. And so while it can be really great to reach out to a nice support in this state of mind when we don't have our full brain to access, having some things to help re-regulate before we're reaching out for support or engaging in risky behavior, it can really shift that trajectory. So some most healthy outlets for those endorphins can include some compulsive behavior like gambling, shopping, cutting, YouTubing, scrolling, gaming, overeating, or food deprivation. So those are less healthy, and risk reduction, harm reduction. We're really trying to meet someone where they're at and change that shift in that cycle. And then the last 2 in the CARES are self-soothe. And so I don't know if the camera is getting in the way or the people on my screen, it looks like some people like that is blocking. Let me see if I can change that. Self-soothing. So like thinking about the 5 different senses. And so like trying to, if there's one or more that really are meaningful to someone, we know that smell is one of the best ways to help someone self-soothe if they have. So we have like a sensory box of smells or textures. Drinking warm water, like it really depends on someone's access to resources for some of these different things. And so like knowing who you are, or if this is for someone you love or in your community, what is a realistic and how can we set someone up for success in helping them self-soothe. So it's 2 different skills for 15 minutes. So they're going to communicate alternatively, release endorphins, and self-soothe. 2 different skills in each of those categories for 15 minutes each, 90 minutes, and then hopefully they'll be in a different brain space after that. Expand this back out so I can see you all. Were there any questions or comments, feedback about any of that? So some different resources for children, youth, and families. The organization I work for is Community Youth Services. While my program is only in Thurston and Mason counties, we have programs in Pierce, we have programs in Lewis. There's a link at the very end of this that has our program. There's a QR code for my program, the Transitional Age Youth Program, but just trying to think of like different areas that might be helpful if you or your families, your community are looking for things and happen to live in either of these 2 counties. I know that these are in Mason and Thurston counties. In Gravity High School, we have case managers at Gravity High School, so we're not, we're in partnership with them. But Parents as Teachers is incredible, independent living skills, our therapeutic foster care. We work with BRS Youth as well. I feel really able to talk about multisystemic therapies and the Transitional Age Youth Program. I just met with the setup program in ILS last week. So if you have any questions about any of these, I'd be happy to talk about them.
I think it was my boss who was addressing the independent living skills. Potentially, is that your guys' new program that's being started?
It's not new.
Okay. Maybe
It's
that
for,
was one.
so that is for foster, for youth involved in the foster system. Yeah,
Okay.
that's great. Is that what you were thinking of, or is that something different?
It's something different. I know she was talking about how I think it was CYS was doing trying to help youth who are homeless to be able to have what is it? Basically housing. Because I had encountered a youth who originally had been living in his car, so we were kind of talking on things, and then he figured it out, so he didn't need resources anymore. So that's kind of where my brain went with it.
So young adult housing is,
Okay.
yeah, that, and that's just, that's, I didn't include on this because it's not in Mason County, but if you go to the communityyouthservices.org website, young adult housing is on there, and I think it goes into each of the different programs that people can look into.
Okay, perfect. Thank you.
Yeah, thank you. Hey, Aubrey, I see your hand is up.
Hello.
Hi.
Thank you for that information. That was wonderful. Okay. You're on my big screen, so I'm over here. Does CYS help dependent youth with financial aid services, or do you refer to the Gravity and Setup programs?
We would refer to help them. Both of those, both Gravity and Setup can help with case management in applying for financial aid or in navigating career or educational like next steps.
Awesome.
Yeah.
Great, thanks.
Of course. Any other questions? I kind of love that this is virtual because we can all be together. I think because it's 5 different counties, it would be really difficult to have a central location, but I kind of wish we were all in the same because I could see everybody's face, and just all those nonverbals are so helpful sometimes. But really appreciate you all being here. And I'm happy to go in whatever direction, but just wanting to make the most of your time. Oh, hi, Maria.
Can you talk a little bit about your behavioral and health and wellness? I saw that's your next slide.
I would love to. Thanks for that setup. So I again work for the Transitional Age Youth Program, but I really wanted to talk about Wraparound with Intensive Services. So Catholic Community Services also works with Wraparound with Intensive Services. If you all feel really knowledgeable about this, I don't want to spend a lot of time, but I also feel really passionate about it, and so I'm happy to answer any questions. So one of the things that we're seeing in that was talked about by Commissioner Mejia, that was talked about by some of the panelists, is that gap in levels of service. And so we have traditional outpatient. When I think of community mental health, I think of traditional outpatient, intensive outpatient, and then long-term or short-term inpatient. And so what Wraparound with Intensive Services is meant to do is to bridge between traditional outpatient and inpatient, keep people in the community, keep people within their schools, their life, so that they're able to expand their skill set and get their needs met without having to be removed, so that that transition back isn't as difficult. With Wraparound, I think Wraparound began in the 70s. I'm hoping that's correct, especially since this is being recorded. But we know that Wraparound is really radical in helping bring everybody to the table. So we have social workers, we have parole or probation officers, we have educational administrators or educators, family members, faith community members, like there's multi views on an individual and or their families. And so it's really meant to be this very radical way of joining with someone in sometimes some of their hardest moments, or maybe they haven't, some poor decisions have led to some outcomes or some consequences that they're having to really answer to or for. And so having that group of people that really want to elevate the youth and families experience, learn who they are, what's important to them, and come from a culturally sensitive and humble approach can be really incredible. So that is the idea of WISE. WISE is a statewide entitlement for youth between birth and 21 years of age in any county in Washington. It just can look different in different counties. And I can speak to Mason and Thurston counties. And so there's Catholic Community Services for all eligible ages of WISE youth. There's the Transitional Age Youth Program that I work for, 15 to 21. We really work on specializing in that transitional age youth population. And then Multisystemic Therapies works with 12 to 17-year-olds and their caregivers that are often displaying problem behaviors in multiple areas, whether that's running away, conduct, substance use, things like that. So here's how you can make a referral to the Transitional Age Youth Program. One of the things that I really love about my program is that we work with 15 to 25-year-olds. And so we have a lower level of care than Wraparound that we call core. And so that's more of a midpoint level of outpatient care. So it's one-on-one with a therapist. We do not offer care coordination, crisis services, or peers with our core services. That's the Wraparound with Intensive Services model. But we can offer home and community-based outpatient services. So it's really wonderful to be able to go into schools. It's wonderful to be able to go into someone's home and meet them where they're at. We don't work traditional hours. And so being able to meet with someone, especially with that older young adult age where they might be working and they're not able to work and attend therapy between 8 and 5. So we're really flexing our time to be able to meet with youth and families to match kind of that WISE implementation, but not necessarily that level of services. And that's in Mason and Thurston counties. I think Maria was the one that was asking, you're not on my screen anymore, but I wanted to make sure. Yes. What other questions did you have?
I was just wondering, so I'm a pediatrician in Olympia, and I think this is a great venue to learn all about the services. I think there are a lot of great things out there that some of us don't really know about, and so this is really helpful. I was just wondering, when we make referrals like that, how quickly can these kids be seen? I've had not a lot, but several patients who've been part of the WISE program. And it takes like weeks to months to get into that program. And so, yes, everything you're talking about with anxiety, stress from the pandemic, we are seeing tenfold since the pandemic. And so it's just hard to know where to get help for these kids when, you know, the wait times to get in to see counseling or any of these programs is months. So just wondering about, yeah, the time frame to get into those programs.
That's a great question. And I was actually in a meeting actually with Sarah yesterday where we were talking about it'd be really great to have some kind of like crosswalk of like, if it's this insurance, here are the different providers and here's the different wait time, because we get into like this, like these are for Medicaid eligible individuals. We do have some non-Medicaid slots for tribally affiliated, undocumented or private insurance, just to have some parity between Medicaid and non-Medicaid, but they're limited. We have 3 in my program, and they get filled up really quickly between Mason and Thurston counties. So the transitional age youth program, because we only work with 15 to up to 25-year-olds, we have the shortest wait time. It's usually immediate to get in. If it's for wraparound, it does go through Donna Obermeyer, our WISE coordinator, and she's the one that helps, whether it's by talking to you all as the referral source or the youth and family to figure out which program is the best fit. Multisystemic therapies has typically has the longest wait list or the longest interest list. They are more intensive as far as their time period. They're typically 3 to 5 months in working intensely with families and youth to increase more helpful behaviors. And they have a team of 6 therapists. And so that's typically the longest, so it's getting shorter. And then Catholic Community Services is really incredible. And I know their wait list has really, or their interest list has really dropped. We meet on a monthly basis with the managed care organizations and the Thurston Mason County Administrative, the ASO, to talk about interest lists, referral sources, and things like that. And so feedback would be really helpful in what you're seeing, in what's working and what's not.
And I was just going to add, we collectively as part of our FISPERT, I don't know who knows what FISPERTs are, they're Family Youth and System Partnership Roundtables, and they exist across the state. Ours in Thurston and Mason is called the Systems of Care Group. We created a website sort of to help with those things. The intention was to manage the frustration that youth and families are facing with trying to find services. So the first question was, what is your insurance? And then it would filter out any services or programs they didn't qualify for. That it exists, the infrastructure is there. Certainly, if it's something that would be beneficial to the community, I think we could revisit how we do that. I think there were funding issues and maintenance issues and COVID and all of those things. But I think it was intended just to address the exact same thing. The other resource, I don't know if people are aware, is the Seattle Children's Hospital has a mental health referral line. And I'm happy to put that in the chat, but I've had really positive feedback from families that we've directed there. But again, what families can do, they can fill out an online form or they can call the line. They provide their insurance, where they live, that they're interested in a provider within X number of miles, and they do all the legwork for them. And then they get back to them. Usually it's like within a week. I hear from families it's often quicker. And here are the providers in your area that are accepting your insurance and have openings. So it reduces some of that burden from families.
Yeah, I mean, I use that line frequently, and and Seattle Children's is great. You can also call and talk to a psychiatrist.
PALS line, yeah.
Yeah, the PALS line. So, yeah, I mean, we're pretty familiar with that. But even then, I think the mental health referral line, it used to be parents could call and talk to someone right away. And now it's, several weeks to get a call back, unfortunately. But, I think that's kind of just the way it is these days. We at the Academy of Pediatrics have advocated for more funding for that line, just to have more access for families. But I think the other thing too is, again, kind of meeting kids where they are. So in order to do that, the families have to call and seek counseling. Oftentimes these kids don't want to go to counseling, right? So how do we incorporate things maybe in schools or groups with friends where it's they're more open to these services or these coping skills, because honestly, what kids want is not, a phone number to talk to someone they don't know. They want connection with someone who truly cares about them. And that if it's not at home, if it's not a parent, it could be a teacher or a coach or something like that. And how do we kind of make that happen in a setting where everyone's burnt out and we all have so much on our plate? I think it's great that we're talking about this, and I think with kids, it used to be taboo to talk about depression, anxiety, and now a lot of kids are coming in and talking about it, which is fabulous. But I'm just not sure that I personally or the medical field is serving them the best way possible.
And we do have a model of student assistance that provides these supports and services at schools. It is very small right now. I think I talked about that on the panel, the AESD COVID response. In Thurston County, it's at Tumwater Middle School. So we have a staff there. She does prevention intervention. So she's in classrooms, so students build familiarity with her, and then she does early intervention. The model that we use is called Trails. Trails to Wellness. It's a CBT based model on building coping skills. So it is that small group intervention. Oftentimes kids end up feeling really connected to the others that they're in group with and connected to that student assistance professional that's delivering that service. Again, one school, one place is not going to impact all of the students across our region. But I think what's exciting right now is that we're able to show that this is working and that it has an impact, and that students are showing outcomes academically, even though that's not an intervention we're providing. They're showing outcomes related to increased hope. They're showing outcomes in terms of reduced mental health symptomology. And so I'm hopeful for our opportunities to expand that service. It's student assistance is not new to us, and across the state, we've had substance abuse prevention and intervention models. And this is exciting because, we've said for a long time that kids don't just magically wake up and have substance use issues. Like, there are things that are happening before them. And so this has been an opportunity to expand that and actually show that even when all we're doing is addressing their mental health issues, they're also not initiating substance use, or their substance use is reducing. And so I'm hopeful for transformation, because when we look at CPWI sites, that's community prevention wellness, that are focused on substance use, those are pretty comprehensive. We have several sites of those. And so being able to enhance those, we're hoping with that mental health promotion and early intervention, there's an opportunity to reach a lot more students.
Yeah, thank you for that. I apologize, I jumped in late, so I missed the panel discussion. But yeah, it's really helpful to just, know the services in our area. Because again, I know there's groups, there's doing fabulous things, but sometimes we just aren't aware. And so having that to share with providers and, community groups, churches, those types of things is great. And I'm part of the Tumwater Hopes. I don't know if you've heard of that, but yeah, we're really focusing on mental health and the relation with substance use.
So yes, Tumwater Hopes is the community side of student assistance. So every coalition has a student assistance professional in the school. So NASCA Marilees, who you may have met, is our staff who's at Bush Middle School. The difference between what she does at Bush and what our staff at Tumwater Middle School does is NASCA doesn't do the mental health promotion and the early intervention for mental health. Again, we're hopeful with the data that we're seeing that we can make the case that that is important. But because again, if you're familiar with Tumwater Hopes, and that we have that in Tenino as well, and we have that in a number of other communities. So if we can expand that, we just have a lot more reach. And then also the COVID response model doesn't have the community coalition. But Tumwater Hopes does a good job of bridging the whole Tumwater community.
I really appreciate everything that you all are talking about. And Sarah, I'm so happy that you're here. You've added a lot of content to this, which I appreciate. I know that we only have, I think, 4 minutes left. And so I did want to talk a little bit about Family Alliance for Mental Health. So I mentioned Donna Obermeyer earlier. She has multiple different hats. I checked in with her earlier this week just to make sure it was okay that I shared this with you all. But this parent network for parents and caregivers is pretty incredible. And this is a different hat that she's wearing from her WISE Wraparound with Intensive Services coordination. But this was established in 2008, really as a place for caregivers to come together, ask questions, get support. And there are 2 different coordinators, Sarah and Charisse, for Mason and Thurston counties, but I would highly recommend to anyone that might benefit to check this out. Just have the best things to say about Donna and all the work that she does in our communities. I don't know if you all have heard about Family Alliance. I wish I'd put something about the system of care partnership. We have we have a meeting actually tomorrow for our county FISPERT for Wraparound. So that's exciting as well. So I had included, I just think leadership and teaming are pretty profound. This is a pretty humbling experience for me. I was a supervisor when COVID started, and I think I shared becoming a, maybe whether or not it really ties into my professional development, definitely my personal development as a mom has been, it's been incredible. It's shifted everything. And so really looking at leadership and teaming in multidimensional ways, I just think Jenny Clark is phenomenal, and getting to hear her speak. She has a podcast. I really like her message. I feel like it really aligns with at least how my program, my company, the people that I align myself with, my community, that these values all really align. And so being able to have this space with you all and talking about trauma and mental health and moving forward together, this just seemed like a great resource to share without a lot of time to really be able to go in depth. If you had an opportunity, I think Jenny's message is really powerful, and wanted to share that with you. It's saying we have like a minute left. And so then also all of those different, not all, but a lot of the different resources are listed here. And then at the very end of this, I put my information, just in case you had any follow-up questions or that you wanted to call, email about. I'm not going to end with that slide. I'd love to have this one be the last one that we see, but hopefully you all have access to that Canva presentation and then the different links as well. Hey, Aubrey, I see your hand up.
Just clapping for you. Thank you.
Oh, you're clapping. I couldn't see it looked like a little hand. Thanks, Aubrey. I appreciate that. Are there any other, in the last 25 seconds, anything else that could be helpful? If so, please call, email, text to my work cell. Loved being in this space with you all. Thank you so much.
Where I would show like all of our digital resources, all of our trainings, everything, so folks could kind of get used to navigating. And we would do a little presentation on how to get a library card, like the basics, but then also actually how to navigate those digital resources.
Oh, okay, cool.
So that is always, I have that as a template. So that's something I can always just do in both languages really quickly,
Yeah.
But I've always thought now that we're open and stuff, it'd be great to have computer classes come in, because we can organize it either before we're open or after we close, just after, and do physical tours and have the computer set up and see what resources we have. I think that would be fun to do.
Yeah, well, we'll be at the event on Saturday, so I'll get to introduce you to him and all that stuff. So yeah.
But I also want to hear everything about the program you're working with, and it is connected through Evergreen, right?
Yes. Evergreen is the grantee for the Upward Bound projects out of well, there's several Upward Bound projects apparently in Tacoma and Lakewood. We're the only ones in Shelton right now. So yeah, we're federal college access program. We help students who are low income or the first in their family to go to college, get a college degree. We're accountable to that degree for 6 years after high school graduation. They need to go to college right after they graduate from high school. And we're not working with them while they're in college, but we do connect them with those college resources to ensure that they have better skills to be retained. And we give them a lot of skills before they go off to college. So right now I'm getting ready for our summer program, which is crazy. We always offer like STEM and humanities, and since it's evergreen, we like to do like interdisciplinary stuff. And speaking of library resources, I'm actually like, I scheduled the library day for us to like, I'm having them do research. I scheduled the library day at Evergreen for them to tour the library and everything. But I recently heard from our grant accountant that she goes to the Timberland Library all the time and gets audiobooks. And that's something that we have a few students who are on like 504 plans and who maybe speak English as a second or third language out in Shelton. And so having audiobooks where they can read and follow along. We already have like reading groups set up, but that's something that I feel like I need to get out to one of the Timberland libraries at some point and get our students connected with a library card, get them like connected with audiobooks and stuff like that, if that's possible.
Yes, absolutely. That's 110% what we would love to do. And any of those, you know, there is our Shelton branch who is incredible. And
yeah.
Our coworker, Sean Locke, who works out there, has fantastic Spanish language skills also.
Okay.
So we try to have somebody who has some level of bilingual skills available at all of our like major kind of branches that are like participating in those communities. So for example, Sean would be our contact there, but you can always contact me and we can put you together with a person if language is like, we want to make sure that's never a barrier to getting services.
Yeah. Well, right now our students mostly speak English pretty comfortably, actually. I think South Sound Learning, when we first started, we had a lot of students who were fresh from Guatemala coming in, and we were like in the ELL classrooms and stuff like that, trying to get those students to see college as an option for them, you know, as a path to work and stuff like that. But what happened was like a year after we got our grant, South Sound Learning, I think that's what it's called, or Sound Learning came in and started working with the students, and now they kind of funnel through Sound Learning. And so we get far fewer students who are fresh immigrants and who are, you know, very unfamiliar with English. It's not as common that we'll get those students in our program anymore, which is unfortunate, but it is good that Sound Learning has that partnership with SPSCC, and we're trying to build a partnership with them. I think that we need to find a way to connect with Sound Learning a little bit more effectively. Like I need to find a way to get my students in there.
So if you want to partner on making a partnership, we can do.
Yeah, like they're very down to business there, and I really love what they're doing. But we're really like try to get them to 4-year colleges. We know the statistics for graduating from 4-year colleges are, you know, significantly better than graduating from the 2-year colleges. And so since we're accountable for the 6 years, graduating within 6 years, we want to increase the likelihood that they're going to graduate. And so I feel like maybe they see that as a little bit too much at this point. And so we're trying to work with them to figure out how to use that partnership with SPSCC that they have to kind of create a pathway. And I think that some things that Evergreen's working on right now is the way to do it. Let's just say that they're working on some really cool stuff if they get it, but I can't go into detail about it, especially with things being recorded.
I understand.
There's no promises yet, so I better shut my mouth.
And these sort of things, they take like so long to kind of develop, and there's so many stakeholders, so many processes engaged, you know, it can really just, but that's great that that's being worked on. But as far as like getting library sources for any of your students, you know, we can definitely organize either library visit, like I was talking about with Kayl, we could do that. We can also have, if you guys do online things, like we can have library people just come in for a Zoom call, get everyone kind of familiar send out the application to you, have it printed out. You can even print them out. You can come pick them up. We can have
That's a
everyone sign
question
them.
then. You gave me an
Yeah.
idea.
Yes.
So we have a culture night where families are going to come. They're going to share dishes that represent their families or their culture, something they're proud of. The students are going to organize the whole event. It's going to kind of take place in the afternoon. I don't know if you guys have people working in the evening time, if anybody would be able to table and just kind of give out library
Absolutely.
cards and maybe show where the library is in the community, because I feel like I want my students, we have a reading initiative, a literacy initiative in our program that we're trying to get students to read for fun. That's a big problem with our alumni, is they can't keep up with the college level reading expectations. And so we need them to casually read so they get that practice and interpreting what books mean in a low stakes way. And, you know, they don't just have those tests where that's the only opportunity to actually interpret literature beyond what's written on the surface. So.
And I mean, as library folks, like we know like from 0 up through 99 and above, like being engaged in reading and enjoying it is what actually keeps you to be a lifelong reader. And it's not just about reading, that's what keeps your brain and that curiosity going, right? So yeah. Not everyone is a reader. You know, we have our ideas about what being a reader is and what it isn't. And it's just about curiosity and engaging in information and feeling confident to find what you need and what you want. And you put a book in a hand of someone who is actually interested in what they're reading, they're going to stay engaged with that much longer. And when they do have those challenges that come up, like a test or something, that doesn't seem as scary anymore, because we have confidence, right? I mean, that's what we do for our children. And then we do that so young because those are adult skills that actually end up paying off so much later. So yes, we do outreach. That's one of our main goals right now, is to do that. And yes, we can always adjust our schedules to come to any event. So let's definitely exchange emails, and no matter where the event is, we can put you in touch with someone to come. And I will say, as far as like reading for fun and reading initiatives, and Holly can attest to this, we love that. And we have our summer library program starting up June 1st, which is all about having that kind of fun engagement reading. And it is open to all ages. But I know that, at least in Olympia, and I know Lacey has one too, like we're creating like an adult version that's like a reading bingo, you know, and it's like geared towards adults, and it's for like teens, adults to sort of like, and they're little like reading challenges, but it's like for you to read something you really want to read, you know?
Yeah.
And getting people involved in that SLP process, summer library program, is just a really great way to sort of engage that like joy of reading and what that can be, you know, because you can kind of make it meet you where you're at. And we have that available in English and Spanish, and we do that with the reading bingo too. Because even if you do have, I think, language skills in English, which is fantastic, it's great to have materials, not just that's languagely responsive, but culturally responsive as well.
Yeah.
You know? It's an invitation, right? To like,
well, it's different. Yeah, it's different speaking Spanish and, you know, hearing Spanish versus reading Spanish and getting broader ideas in Spanish and more abstract concepts in Spanish. Yeah, I've done some, I don't even speak Spanish, but I've done some reading in Spanish in grad school, and it's definitely a different experience, and it's worth it if you can manage to do multiple languages. The literature is different and the expectations are different, and it opens up a different world. So my degrees are in English.
Thank you.
Yeah.
No, I really feel like we would love to come to your cultural night. We're, like Holly said, Kayl, and we you know, for all of OST right now and Lacey School District and Tomar, you know, we're going to all the multicultural nights for that age group. But I think it's really key that we do that with our teens and our young adults as well, you know?
Yeah.
So that would be fantastic. And I do have, I can send you, does the chat work in here? Yes, I
I'm
think
not
so.
sure.
I'll send you my email. If that
Okay,
works for you. And
definitely.
I also do have I have it in English and Spanish. I kind of created a link. I have like a sheet that has like all of our resources for either Spanish speaking or Latina community
Okay.
members, that has like all of our kind of resources that may be of use. And it is like adult basic education stuff, GED stuff.
Okay.
You know, there's all those online Overdrive, which is going to be our audiobooks and ebooks, all those kind of resources are available on there.
Yeah.
And the digital version, which will last for 90 days, has links too, which is nice. But we can also, I can send you anything and kind of create a little class for
Okay.
everyone. Oh, and I was gonna say too, I think one of the reasons Cheryl invited me here today, and is the program you work with, are they connected with Trio also? Is that
Yes, we are one of the TRIO programs.
okay? I've been learning a lot about Trio a little bit. I work with, part of my job with the library is I serve on the board of the Hispanic Roundtable, and our main
Okay.
goal is we organize the Latinx Youth Summit every year.
Yes.
Which last year we were at Evergreen, so maybe you
Yeah,
saw
yeah, we were
our
there.
madness, our
Actually, I think I hosted one of the
oh good. I think you did too.
yeah.
I was like, I recognize your name. I think you did one of them.
Yeah.
And we had, I believe, Trio students, I think for the first time in a large group come this year. And that was really fantastic. And we were
It might have been my students, actually.
probably.
I think we were the most represented at the event is what I've heard.
Yeah.
So it might have been a bunch of my students.
I love it. That's so great. And we're excited for, we're already starting planning for next year, which is always great. And we'll be at Centralia.
Oh, okay, cool.
Centralia College in 2020.
Students have never been there. That's a great opportunity to see that school.
Yeah, that's going to be fantastic. And Centralia College has so much responsive programs.
I think they have an Upward Bound too, don't they?
They do.
Yeah.
They work with Trio really closely as well. They have a large leadership contingent there that is from the Latina community and like in administration and student led. So they're like really engaged in many ways in creating those pathways to higher education specifically for the Latina community. So they do a lot of that frontline on the ground work. So it's always great to work with them. I mean, a lot of our colleges do, but they put in a lot of work. So it's going to be fun to be there. And I think that's going to be a really fun time for your students. And it's very like college-y environment. It's kind of a fun place. They've got so many programs, and they've got a lot of like student leadership opportunities there.
Yeah, and I think that my students at Shelton, they offer applied bachelor's programs. I think those are the types of programs that my students are interested in. It's close enough that if they really wanted to, it's not fun commute, but they could commute if they really wanted to. I think that would be a really valuable location for them to see. And it never occurred to me to visit there because it's like SPSCC, it's like right next door. So why would I take my students to SPSCC when they have opportunities to go there all the time?
Yeah, definitely. So, and that is one of the great things about the Latinx Youth Summit, because we have these county.
I'm plugging in my computer. I'm right here.
Oh, of course. Because it's like rotates across campuses. It's a great opportunity for students to visit lots of different kinds of college settings in their region and see just the wide breadth of options that are available to them, and how these different institutions are responding to them as individual students and as a community, on that they want them to come,
Yeah, exactly. And that they're especially opening their arms to the Latinx community. At first I thought I was supposed to have a presentation ready to go for this thing. So I started working on, I started working on a presentation on engaging Latinx students in STEM, because there's a lack of engagement in STEM, and there's actually a lack of just Latinx in STEM, period. And of course, that extends further to Latinas, to women, of course. And my husband's in STEM. And he is really like, he's looking into how do you get to the graduate programs in STEM? How do you become a doctor? How do you get your master's degree? Because he wants to pursue these things. But at the stage of documentation that he's at, you know, because he's still working on that stuff, he's having a hard time accessing the different types of funding that's available. And so that's something that we need to make a little bit more well known in the support communities, is that not only is there not really access beyond, if there is a lot of support for the bachelor's level or associate's level for the Latino communities, there's not a lot beyond that. And if you even look at the graduate cohorts in STEM, they're not made up of a lot of people of color, period. But if there are people of color, they're probably from the continent of Asia somewhere. The likelihood is very high.
I mean, you know, the numbers of Latinos and Latinas getting into college are so much lower than other groups. And then if we're
especially immigrant groups.
Yes, exactly. And immigrant and refugee groups. And then if we're looking even further, like you're saying, to those other levels of education, we're dropping like so low, or below the bar, you know. If you would like, I would love to invite you to come. We're the Hispanic Roundtable, we're starting to open up our meetings to community members to kind of be more responsive and a part of what we're doing there. I would love to invite you to our next meeting, and I can send you the invite or get you on the list. And we often have community members come and do presentations. So that presentation sounds so up our alley. I would love to have you come and do that just a little presentation. And it's very casual. We're just all like stuff. But just
that's something to do with that research.
Yeah, exactly. I'm like, oh, don't throw it away. We could use it, because we're always looking at how to make Latinx Youth Summit looking towards the future, you know, because it is an event that's been going on for 20 years now, and we want to make sure we're staying current and really responding to the community needs, right?
Yeah.
And like looking forward to like, what are the next challenges? What is that next level that we need to think about? And, you know, access to resources based on documentation or like those kind of barriers, it's hard to talk about. There's a lot of stuff around that, right? So having folks talk to us about it, and we always try to have workshops about that at Latinx Youth Summit, and to really get as many perspectives on that as possible, I think is so valuable to us as we continue to plan. And so when you want to come, I'll send you the stuff.
Yeah, that would be great. I would love to come and speak. I don't know if you have like a timeline in mind. I do have like this big summer program, like I mentioned.
No problem. Yeah, I'll send you the invites. I'll put you on the list, and you'll get an invite like every month. It's the last Tuesday of every month.
Last Tuesday of every month. Okay.
Last Tuesday of every month. But I'll talk to our admin person and put you on the list to get the invite. And then if you would like, since you're going to be busy during the summer, we could put you on for fall to do a little. But you can like just pop in and see what the meetings are like in between time, you know.
Fall might be a great time. Either late summer or early fall might actually be a really good time, because it's before the FAFSA opens up, which is now, I believe, in December, and before the deadline for the big STEM school in the state, which is UW. And our students are very interested, even if they're the ones with the 4.0s who, you know, they have the potential to go somewhere like the University of Washington. They have the potential to become doctors. They stop themselves because in their community, they don't become doctors. They become nurses. They become the nursing assistants, you know, they become the receptionists. And so I want to change the culture where I hear my students not say, I want to be the nurse. I want to be the resident nurse. You know, I want to be the doctor. I want to be the nurse that's going and having authority and not answering to people, you know. So I want, since my students are so interested, especially the Latinx students, they're interested in healthcare. They're interested in giving back to their community, especially through health. Like, how can I make sure that that's accessible to them when they're not seeing a lot of doctors who look like them, especially when you look at the professors at places like the University of Washington. It's really interesting that Seattle is a very, very diverse community, but the University of Washington does not represent that community in Seattle. In Tacoma, it does. So that's
Mhm.
very strange, you know. Well, it doesn't
Mhm.
exactly. It's just that it's more balanced. But it is kind of telling where people are kind of being funneled. And I think that that needs to be changed. So if I can speak to the Hispanic Roundtable about that, I would love to. I'll probably see if I can sign up for another workshop again, because I love to talk to the students, because that's
Yeah, well,
our,
definitely. Yes.
yeah.
Yeah. And I think I was gonna ask you, I had a question, like, what do you see as that barrier? Do you feel like, are you seeing from your students, or am I hearing like they're kind of self?
There's multiple barriers.
Yeah, there's multiple.
Yeah.
Barriers. Like, I mean, obviously there's like material barriers, I would
Yes.
imagine. And then like representation you see as a barrier as well.
I see that as a huge barrier, actually,
Okay.
because they don't, especially within their own community,
Mhm.
because they don't see people in their own community who they see as successful in positions that require college degrees, especially degrees beyond the bachelor's level. And so in Shelton, I think it's not even common to see people with beyond an associate's level in their community. And a really good case study is I had 7 students who are immigrants from Guatemala. Many of them are Silese, not even permanent residents yet. And I got them thousands of dollars. They had a free education at Evergreen, multiple of them. I got thousands of dollars in scholarships. I didn't do it, they did it, but I helped them get like lots and lots of money. And they didn't do it. They didn't do it. And that I think has a lot to do with well, maybe the pandemic. But I do believe that since that trend did continue afterward, when the opportunities were given to other students from similar communities, that there's something stopping them at the beginning, and then there's something stopping them at the end. And it isn't just the money. There's something that's, if it's money driven, it's because they have to give back to their family. So I think that's a big culture thing. I don't think they realize that college doesn't just take money, it gives money. And that's something that the families, my alumni have told me, if I knew how all this money stuff worked sooner, I probably would have stayed longer, or my parents would have been more supportive. So I think on our end, we need to do work. The educators need to do work to talk about how we can make this accessible for students, and how what they already have is, you know, available to them can be accessed. There's also a bunch of barriers within their own high schools. High school's hard. High school sucks. It sucks for everybody. I don't meet very many people who said, I loved high school. It was great. You know, unless they didn't go to college afterward, you know, like maybe that was the best time of their life. But no, high school is hard. And especially for the students who don't speak English as a first language, these systems don't exactly make it easy for them to feel like they're succeeding, even when they do have a lot of assets. So for instance, if I have a student who's really good at math, but has to get up and move every once in a while, or has to like draw pictures while they're taking notes and stuff like that, they're considered a bad kid because they're not paying attention, because they have like ADHD is what the teachers prescribe, you know, like that's something where they're looking at the deficits. And there's a lot of educators who do that. You're not ready for 4-year college. You should start with a 2-year college. You're not going to get the money. You're going to have to take out student loans, and student loans are so bad. They're going to get a credit card or go take out a car loan soon enough. And you know that's going to happen, teacher. So what are you doing? But I've had teachers, especially in the Native communities, actually actively discourage students from even applying to 4-year schools, because they feel the heartbreak of not getting into the school is going to be hard for them. But if we educate the communities on, you know, here's what the school's expecting, here's what you need to do if you want to stand a chance to get in, here's some backup schools with, you know, a higher acceptance rate. Are you ready to go to these other schools too? The student end can be worked on, I think. What we really need to work on is the post-secondary end, because the bachelor's level, we're getting all this money from the state saying, yeah, get Latinos in STEM, get these low-income students to get bachelor's degrees. They don't care after that point. So how are we supposed to get more Latinx doctors? I've had bad experiences with white doctors, like even just giving birth to my son. There are not a lot of people who have a lot of empathy for people of color if they're not people of color themselves, you know? And so we need more people in healthcare who are from these communities. And I know that the healthcare, they know that. But when you look at the acceptance rates for these programs, you look at the graduate cohorts, they do take a lot of pictures of their graduate cohorts. They're not accepting the Latinx students. And you look at the numbers, which I researched for this presentation, we get like 5% getting, I think, master's degrees. It's probably less than 5% getting PhDs, from what I was looking at. It was very angering. And the careers where they're most likely to have a job and keep a job, and do this quickly are in tech, medicine, like these different areas where you can actively see that they are not welcome in these fields. And so STEM is where we need to work with post-secondary institutions on, cash in the checks that their mouths write.
Right, exactly. No,
I'm glad that was recorded. 100%. I guess I didn't say it the wrong way.
No, I think that's exactly right. And just, I think you've touched on so many amazing things in that. And I think to your experience, you were talking about your personal experience in healthcare. I feel like Commissioner Mejia was just talking about that as well. And I know, and working on frontline here in the library, Holly and I see, like, we hear that a lot from folks, like I see it every day, people having that experience coming in and then looking for.
Oh, and Brian working at Cielo, he's telling me all kinds of stuff that he's hearing from just the reasons that people are going to these things,
Yeah, exactly. But I can also think, I would imagine, and I love this idea of thinking about beyond, because I feel like beyond that associates, beyond that bachelor's, how do we kind of encourage that, not just encourage, but like activate, right? Like really try to pull down those barriers culturally within the community and then within educators as well, right? It seems like there's a lot of misinformation that's happening out there based on what you're seeing. And I feel like the Latinx Youth Summit is great for that, like having a whole workshop for students, right? That is about, this is something we talked about last year, is a lot more financial education. We want to really focus on that. What a loan is, what that looks like, not just student loan, but in general, like financial education that's culturally responsive too, right? That takes into account folks who think about a family unit when they're thinking about their finances, this is very key, right? And then also, and this is something we experiment with every year at Latinx Youth Summit, is we try to always provide a class for educators, a couple workshops for teachers. And we did a couple last year, and we did a couple the year before, but I'm wondering now, my wheels are spinning, and I'm wondering if it would be great to offer some kind of class about like what post-secondary kind of education options look like for Latinx, Latino students, and what those options are to try to sort of start changing those perspectives as well within the educator community.
Yeah. There's a lot of like social work. If Latinos are going into, especially like graduate level work, they're going into social work, which is, it shows values. We want to give back to our community. We want to give back to those in our family. And I think that they want to do that in multiple ways. And I think that it would be helpful if educators recognize what this is saying. If everybody's going into social work, where are the people who don't make it as far as they try to go? Where would they be going? Because that's a more accessible route for.
Right. And changing the perspective and talking about how these STEM careers are giving back to community, right? And like talk about how that perspective and just how when we speak about these different pathways that we focus on how this is giving back to our families and our communities. And, if we start talking about them in that framework, then maybe they start to seem a little more accessible, right?
Yeah.
And then when you add in that financial education piece as well, and being like, this is how much money you get when you go to grad school, and what that looks like, like we always want to have, like I always invite a wide range of educational institutions, right, to speak, like 2-year colleges, 4-year colleges, trade schools, because we want to have options. There is no monolith, right? Like we
Yeah.
need different pathways open, but having those 4-year schools there. And I will say about UW, we always invite UW Tacoma and UW Seattle.
Yeah. Do they both come typically?
Typically, yes.
Okay, good.
I try to encourage them both to come.
Yeah. I feel like I've run into them at the Latinx Youth Summit before, because I feel like some of them are alumni of our program that I run into. Like Janet.
It starts to become a little bit of a network,
Yeah.
I mean, Commissioner Mejia, her father was a big part of it for a long time. So
I see. Yeah.
It starts, and I'm fairly new with only being involved for like 4 years, but I'm like, just starting
Yeah.
You start to see like the same folks, because it is a unique event in our region.
Yeah.
There's just not a lot of them happening in the state to the extent that we kind of put them on. But like I said, we always want to move forward with it. And I think this idea of thinking about beyond, and really, how do we really materially encourage these STEM pathways? Because we do talk about STEM a lot, but what does that mean when we talk about it? What are those actual barriers, both materially and then how we communicate about them? It sounds like, because like you said, it's not just the money. Sometimes the money is available, but mentally, right? What are those barriers that are happening?
Yeah. And then how are we taking care of them once they get into college, and it's all students. How are we taking care of all students? Because I think all universities and colleges do fall short taking care of their students. I mean, they're state and federally funded institutions a lot of the times. The ones that are private tend to hire more staff and have smaller class sizes, smaller groups, advisors, and the students tend to graduate at higher rates. So there's a lot of stuff to work on in all of these institutions, and I feel like the educators are gonna have a big role in that, because the more the students come in, the more that they will need to be represented among the staff and faculty, and the more that the post-secondary institutions will have to respond to that. Yeah, University of Washington was the one that stood out the most to me because of the satellite that it has just right next door in a community that's almost as diverse, if not equally as diverse, as Seattle, and yet Seattle is not a very diverse university. University of Washington in Seattle, yet University of Washington in Tacoma is. And so what are the differences between those schools? I know that they have the Husky Promise for the Tacoma kids down there. I know they're trying to recruit certain demographics actively there, so they lower the expectations for admission, but definitely they're not admitting people intentionally at the University of Washington in Seattle. And I think that doesn't match with the mission that they promote, especially with it being such a big STEM school and being so well known. And that's not the only university. I mean, look at the California schools, they're worse.
Yeah.
So, yeah.
But it's good that we have, if we're looking at our region, our area, right? Like we have to kind of deal with what is controllable and what's in front of us. And as we're encouraging the young people we come across, all of us across our desks, we want to make sure that, there's a moment of care, right? We want to make sure that we are like you spoke of, continuing that care. And when we recommend things and, create pathways, that we know what that pathway kind of looks like at the end, and that there's someone at the end of that, right? It's like thinking about those things also, and it's a big thing. But I think talking about it in this and then bringing it to LYS and then your program, it sounds like you're doing incredible work there and getting these students really connected and thinking about really big, those are really complicated, big picture, conceptual. It's so interesting to have things that are like really big conceptual problems, but then they also have very everyday consequences, right?
Yeah.
And see that every day.
Yeah, doing this as long as I have now, I get to see students who graduated back in 2015, 2016, and went through the 6 years or more, and now some of them are in graduate school, and the ones who didn't make it, I know what happened to them, and so, and I know what kind of barriers stood in their way. I know what choices they made early on, and it's really unfortunate that we have to make such big choices as young stupid adults before our brains are even developed.
Well, that's what I was
Terrible.
thinking about when you were talking about like what happens when they go to college, like you're still like young adults. You're not fully,
Yes.
our brains are not done yet, right? And we know that now, yet we're still,
Yes.
our expectations don't necessarily meet that, right? Like there's so much, just the infrastructure, it feels like, is lacking. And then if you scaffold on top of that, multiple marginalized identities within a larger structure, there's even less infrastructure there for you, right? So
yeah,
it starts
exactly.
to feel really insurmountable. And so staying home with family and those, maybe starts to seem a little more comfortable,
It's what you want to do anyway.
Right. I mean, I want to do that right now.
I know. It's like, if I could just stay home with my kid every day, I think I would. I want to be hired as that kid's teacher, just his personal teacher. I'll just spend all day with him.
My God, my daughter asks me every day if I can come and just be her teacher at school.
Oh, that's sweet.
Yeah, she's like, you're gonna go talk to other kids? Why don't you just come be my teacher every day? I'm like, well, I'm not a teacher. Also, you have to talk to other people. She's like, oh, why?
Oh, that's sweet.
But I think but it's like, we all want to do that. And I think like that's the larger thing. Cheryl and Lori and those who organize this conference is like, the pandemic reality that we're still living in, if we're going to be honest, is like maybe even made those feelings bigger for a lot of people.
Yeah.
I mean, I see it in my own child, and I see it in the families and children who come in the building every day. It's harder and harder.
Yeah.
You see a lack of certain, just the ability to kind of like push outside of your comfort zone, right?
Yeah. My son will see that when I go to the event. He's so shy these days, and
Really?
he wants to go make friends with other kids, but he's so shy. And it was funny, I brought him to the event that we had last night. We had a graduation event last night.
Yay.
And all these like teenage girls that I work with are like, oh, come here, because he's 2.
Oh,
come here, I want to hold you. And he comes up to them and just tries to give them a kiss on their lips, and they're like, whoa. And then others are like, come here, and he just shies away.
Yeah, it's just like, what am I supposed, how do I do this?
Yeah.
Well, and we've seen that in the library too. And Holly, I know, can speak on this as well. Her and her staff's experience as we have opened back up, and now we're offering in-person programs for our youth, for our 0 to 6, our school age, and our teens. And we're still doing things virtually. And then we're doing in-person ones, and watching that kind of blossom again has been really amazing. And then watching all those different ages of youth kind of respond to that in different ways, and families and parents, like relief on their faces. And then also like, how do we do this again?
Yeah.
Kind of wondering, is it okay? My kid is like not really good at this. And it's like, it's okay. They don't have to be. You only get to be good at this if you do it, And so many children haven't had that opportunity. It's not just our youngest, it's our middle school students, it's our teens, all of our high school students.
Yeah, you can really see it in the really young ones though.
Yeah.
Especially at story time and things like that. They're just, and we have adjusted accordingly because the social skills that we might have seen pre-pandemic for somebody of that age are not there because of that 3-year miss. And that's fine. We just adjust and accordingly. I see we're about 8 seconds in. Thank you. It was a fascinating discussion listening to you all. I really appreciate that. And Yeah.
Thank you all.
And see you at the next one.
I know.
Okay. Darlene, can you tell me a little bit about you? Like who are you? Like what brings you, like, why are you here today? Like, what are you hoping to get out of this?
Yeah. So, I work for the Army Reserve as a civilian. I'm their health readiness coordinator. And I'm not credentialed. What I focus on is ensuring, that soldiers receive the required medical examinations and dental examinations every year, along with if there are any difficulties with care. So if they've been injured in a duty status. And this is different. Army Reserve is a little more challenging because they're not active duty. Active duty, you're on a post and you go, and it's a one-stop shop. You go over to Madigan and you get all your services. So I do that, but I'm also an Army reservist who is just waiting on this retirement order.
Yeah.
I have my own struggles. So I come to this event for a couple reasons, as a civilian, as a professional, but as a soldier as well, to become aware of who's who out here in our community, representing agencies and delivering, care, and what do they know, and maybe sharing some things that I'm doing too. But I'll stop there because I would like to have time to do that after your presentation.
Sure. And Tracy joined us as well. Hi, Tracy. So Darlene, hi. I was just asking Darlene to share a little bit about her background. And I think one thing, so I started working at Community Youth Services and the Transitional Age Program in 2014. And the year before that, I actually worked on base as it was called ACAT back then, but it was like career counseling for anyone that was leaving service. And so I got to work with, and I worked with Army, Navy, or not Navy, Army or airmen and women that had like traumatic brain injury or had different medical, usually it was medical discharges. And so it was a really interesting job working on base, working with that population. And so Tracy, since it's a smaller group, if you're willing, I would love to hear maybe who you are in your community and what you're hoping to talk about today.
Excellent. Thank you so much. My name is Tracy. I'm with South Puget Intertribal Planning Agency. We are here to assist and support the consortium tribes in promoting and enhancing our communities with self-sufficiency. We're under the umbrella of the Workforce Development Program. So we do STEAM programs for the youth. We do cash assistance. We do workforce development with career navigation, resumes and referrals, and mental health referrals as well. I myself was a client of CYS when I was young. I worked with Lincoln Chase. I don't know if anybody remembers him or knows of him, but he was an amazing person who helped get me into the Evergreen College for my GED and got me into Safe House and just really helped expand my world and the hopes for my future.
That's awesome. I'm so glad.
Yeah, I'm thankful that you're still in existence. I didn't know that that was all going on still.
Yeah, I found Community Youth Services. Well, I started working here in 2014. I've been in the same program the whole time, but just really have grown to love. I've grown up professionally working here, so it's a lovely organization. So I hope that you can see in the chat. I don't know. Can you see the links that I put in, Tracy, before? Like at 9:52, I put a link and then there's kind of a list of names. Okay, I'm going to re-put that here just so that you can have that. So the first link goes to, it's kind of like a PowerPoint presentation, but it's through Canva that you should be able to access now, and you can share it. It's a shareable link. And then at the very end, there are some links referenced in that, but I wanted you to be able to click on them. So there's that. And this is really more meant to be a question and answer. I just prepared this because I love this topic. I love this population. I love this community, and just wanted to have some things prepared in case there were empty spaces. And so if you came with questions that you want to focus on, I know that we want to talk about the CARES coping model because Darlene and I were talking about that right before you came in. But really want this space to be shared and for us to get the most out of it together. So here are the content of what's in this packet. The first really goes over what we know about traumatic stress and anxiety. We know from epigenetics that it leaves a chemical mark on a person's genes, changing how the gene functions. So this can be passed down to future generations. So in talking about genocide of our indigenous people, of our Black people, of people of color, of people from marginalized communities, knowing that violence and trauma really runs bone deep and can be passed down to future generations. So we all came into COVID with already having different traumatic experiences generationally, personally, community-wise. And so just kind of, I feel like that's a really important thing to name with the traumatic stress and anxiety that came from COVID. We're still all learning about the physical, social, emotional, and spiritual effects and impacts of COVID-19. And just because I only have a short amount of time with you all, I really focused my lens on communication, work environments, and leadership styles. But there are significant shifts. I think it's important to note that under stress, we want to reach out. And we were instead, the air wasn't safe to share with other people. We weren't able to go into shared spaces, whether that was out in the community, community groups, faith groups, grocery stores, just all of those different ways that we relate and tell our stories, hear stories from other people, teach, learn, all of those different things were abruptly shifted. And we saw a lot of less helpful coping skills come up, like substance use, food restriction, or binging. And for many, this was a means of survival, of getting through. And I hope that at any point you all will speak up if you want to share your own experiences or ask questions.
Could you just go back once?
Yes,
back to that
absolutely.
slide just for a second. Let me see. And if you don't have the answer, that's okay. I'm just curious, you know, this information that you're putting out, if you link it to a study or if you link it to a particular person, like trauma can leave a chemical mark on a person's genes. I mean, that's a pretty profound statement. And then the under stress, we are hardwired to reach out and socially engage. Again, I think those are sentences that we could easily just read, not saying you are, but other people, and it doesn't have really kind of the impact, but they strike me well because I know something, you know, I'm out there studying different things. And so I guess, you know, again, if you can't address it now, that's fine, but I'm looking for that why is that knowledge significant to communities that you're taking the time, put it on this slide, but should it just be read by community members and just sort of, it goes in and out, but they don't understand the significance of that. So that's what's going on in my gut is, how are we going to have that kind of knowledge be unpackaged for community members so it has an impact?
Yeah, that's a great question. I know that like epigenetics is the first bullet. Like it's interesting, like trying to pair, like no, I didn't know that I'd be able to share my screen. So all of this, like having two opportunities to communicate with people as far as those two different breakout groups, having the ability to share my screen and have these conversations. The way that we were kind of cued for this is that this is a question and answer. And so we didn't have to present anything, but I just wanted to have some, like in thinking about stress and anxiety, yeah, these are 3 bullet points that like stood out to me. So epigenetics, there's a lot of information out there around being able to see I wish I had specific things to link you to right now, but being able to look up that the gene functioning changes. Trauma, I do not know this, I wasn't going to cite this because I don't have the link to it, but I would love to look into it and then maybe send it to Lori. But there were studies done where they looked at like teenage brains and like the trauma, like the amount of trauma that was shown in I think it was like the gray matter of the brain matched like people decades and decades older than they were. Like knowing that, so like in thinking about trauma and mental health for children and youth and young adults, that those brains are still developing and that we are still, one of the slides a couple down will say, like, we are still learning and trying to understand what happened. We're still getting information about, we're still living in trying to understand it. It's much easier when you have a traumatic event and you're trying to heal from it, being able to tell a story of it from a different perspective of like, this was done, like this, it started here, it ended here, and now I'm going to tell this story. And I think something that's been really difficult about COVID is that so much changed. I mentioned in the last breakout group that the Black Lives Matter movement started, I remember starting in 2013. It's been a decade. There's been a lot of community violence. Like there are lots of different like multifaceted things that were happening. It wasn't just COVID. So I would say, yeah, looking into epigenetics would be definitely a pathway to go down. And then just in being people, we have different needs as far as, and different ways of presenting as far as being like introverted or extroverted or different cultural values and norms. But really we are storytellers, we are communal, we share, we learn together. And so I think that's more of that, what I was trying to say under that bullet point of, in trying to really cope with things, whether it's grief and loss, we typically come together. There's a point of coming together. And I feel like that's what this event is trying to really name, of like this, there's this want to kind of like, almost like close our eyes and like squeak through and get through and just be like, okay, that was over. And now I want to go back to this romanticized version of what my life was like 3 years ago. And really like, we have to like pick it up. We have to turn it around in our hands. We have to really be curious. So I don't know if that directly answers your question. But I think
That's
having,
good. I don't want to, stay on this point too long, but I'll just be quiet.
no, please. It's so nice to talk.
Yeah. No, I'd like to hear more. I don't want to
Okay.
run out of time, but I certainly will follow up with questions if I have them.
Sounds great. And so these are the ways that traumatic stress and anxiety these are some of the ways of what it can look like. So things like in the last group I mentioned, like perfectionism, sometimes that's seen as a really like, oh, like that person, like things are going well, they've got it under control. And really it can be on that like verge of like, this isn't necessarily going to serve them in the way where it can lead to some problematic things. Like perfectionism, it's a white supremacy norm. Like it's not necessarily something that's going to serve all of us, though it isn't maybe as harmful as like the self-destructive reckless thing. So like, while these are all symptoms, some of them we can name as being problematic or not helpful, while others can kind of slide in. I don't know if that lands for you all, but I always like to mention perfectionism just because it can seem like a positive thing. This person's really trying and they're that hypervigilance, like they're really, but there might be something deeper going on that's worth looking at. So the next slide talks about what may help. So that first point, acknowledging that we live through something we're still learning about, that I think in these communities that we're in, I think that's important to say and say again and say again. We are still learning about this. While we're in a different phase of it, we're still in this. Thinking about, like, I had a daughter who was 4 months old when things shut down, and she was in daycare with her caretakers. She didn't have access to see their mouths or their noses. We didn't know what they looked like. I would drop her off in the hallway because the air wasn't safe. And so there'd be this quick drop off. While I was at work, I would go to, it was just the wildest. I was working from home, but in order to work, like, she was in daycare, and it just was, it's wild to me, like looking back, that's just what we did. I dropped off in the hallway, didn't go into the classroom, didn't really get to know the teachers, love and trusted them, but like it just was this very like transactional thing out of safety and fear, which is typically a very rich and nurturing relationship. Having to build therapeutic relationships with youth and young adults online, like not meeting in person, not having that like shared space where we're not just having to talk back and forth to keep the conversation going, but there's spaces of silence, there's nonverbal skills, there's all kinds of different things that we're learning from each other and with each other. So things that could help, exploring new ways to find purpose and meaning, building creativity and self-awareness around your needs, being able to connect and tell your story, finding effective ways to stay present, increasing time spent slowing down, breathing, being in touch with your physical body and releasing tension. And then for a lot of people, accessing treatment and working through whatever barriers or stigma comes up around that, and finding treatment that aligns with your needs, and elevates your voice and sees your whole person. I think that's important too. So this is what Darlene and I were talking about kind of earlier on, with this cycle of self-destructive behaviors and the CARES model that Lisa Ferenz, and it's referenced down below, really works to disrupt this cycle and give people different ways to, Dan Siegel talks about flipping your lid. So if this is your brain and you get into fight or flight or freeze, your brain flips. And so a lot of people are aware of that brain flip. And so what this does is we know that it takes 90 minutes to have your brain come back online. And so what we're looking to do is to build self-efficacy and really help people ground themselves to make different decisions. So we're talking about risk reduction and harm reduction, and just really meeting people where they're at. This is a big tool that we use with transitional age youth. And you all should hopefully have a copy of this, but let me know if you want to look at this anymore before I go to the next one. But really thinking about that triggering event, the negative loop, the unbearable tension, and then almost like that frozen or like not feeling anything, and then that self-destructive act in a lot of ways to feel alive again, and then dealing with the positive and negative outcomes that come from that. So CARES stands for communicate alternatively, release endorphins, self-soothe. This model incorporates both sides of both hemispheres of the brain. It can really help when someone's feeling activated and stuck in negative and destructive reactivity. The hope is by going through these different coping segments that the brain becomes regulated and the person has more options as their brain comes back online. The first one stands for communicate alternatively. So we're really looking to process whether they're negative or just intense feelings in different ways. So visually, orally, through language. The hope is to do 2 different skills for 15 minutes each, so for a total of 30 minutes. A lot of times we hear that this feels like it's not enough. And the idea is we're giving this 90 minutes, 2 skills for 15 minutes. It's taking 90 minutes to get the brain re-regulated. Just trying this when you're less activated, like not waiting till you're a 10 out of 10, but maybe trying it at a 5 out of 10 if we're using self-monitoring. So trying different things to see what's helpful. One of the lovely things about this model is that it's designed to be able to be used wherever and whenever someone is. So if it's 2 o'clock in the morning and they're at someone else's home, or if they're in a car and they don't have the ability to get out, really increasing that self-efficacy so that we don't have a safety plan or a list of skills that may not, like going for a run, that can be lovely, but if you don't live in an area where that's going to be accessible all the time, that may not be the best coping skill to have on your plan for regulation. So communicate alternatively, 2 skills for 15 minutes each. The next one is release endorphins. So 2 different skills for 15 minutes each. Things like running, or like running up and down stairs. So we're not running around the neighborhood or running around, but like really trying to think of like what is realistic for someone to be able to do anytime, anywhere, doing jumping jacks, watching pre-approved TV or movies that aren't going to reactivate. So we're not starting that cycle, that 90 minutes all over again. What really is going to help release endorphins in a way that is the healthiest way possible. Some less healthy outlets can include compulsive behaviors, like some of the ones listed. With risk reduction and harm reduction, we really are trying to meet someone where they're at. And got a chat and ooh, Tracy found some. Thank you for that, Tracy. I don't know if you can still see my screen, but I opened up the article that you found. Can you see do you see the article on my screen, or do you still see the presentation? Just the presentation. Okay, I'm going to go back to, oh shoot, where did we go? Okay. So thank you for that. We'll definitely want to look into that later. But the idea behind this is you're releasing endorphins. We're, again, trying to use both hemispheres of the brain. Do we want to talk about the article that you sent, or should I keep going through this? Okay, I just wanted to make sure that we're sharing this space well. So sorry. I'm hoping maybe after the cares. The last part of the model is self-soothe. So really looking to engage the senses. Smell is a really powerful way of engaging textures, drinking a warm beverage, like what's within this person's, within yours or the person that you're wanting to, oops, sorry about that. We're going backwards. Here we are. And similar to the releasing endorphins, there can be things like playlists, podcasts, or things like that, but just making sure that we're thinking about it when we have access to all of the best parts of ourselves versus trying to make a decision in that heightened, more agitated, triggered place. The 2 skills for 15 minutes each. So by the time that we've done the 6 set of skills for 90 minutes, most likely we're more grounded, more resourced, and can assess whether that was helpful or not. I don't know if you all have questions, comments about the CARES model.
I don't have any questions, but I might, I don't want to move too quickly. I don't know what kind of time we have left, but I also have a resource and something to share, but I want to wait.
Please. Yeah.
Okay. So it's incredible what is happening out there right now. Besides in-person events that are addressing mental health, well-being, and so forth, but there's many online. And I'm going to put the link in one of them. It's called Rewiring Your Brain. And that's all these online events are free. And it's all the people that are out there. Some are considered now, they're still considered cutting edge, but there's a lot of folks that used to be considered like cutting edge on the fringe that are well accepted now. And you did bring up one of those, one of the presenters. I don't know if he was ever considered cutting edge, but Dan Siegel.
Mm-hmm.
So I just saw him on the Super Reset conference. I think it was called something like that. And again, you have about, I think they run anywhere from 5 to 7 days. You have access to all these recorded workshops with these folks who are neuroscientists, they're medical
These
doctors.
are big names. Yeah.
Oh yeah.
Gabor Mate. Yeah.
And many that we haven't heard of
Mm-hmm.
too, unless you're out there kind of keeping track of them all. But again, you know, it's so sad that like those are not well known, but I started looking into health and wellness and not just traditional approaches some years ago and become aware of what's going on out there. And it's exciting. And there's a lot of great info that may take years to come through a regular doctor or, you know, a friend who might recommend something. But anyway, I put the Rewiring Your Brain Summit here, but there was a self-care summit that took place in a reset super conference where, you know, people are just trying to reset their bodies and their nervous systems and so forth. So that's all.
Is
Yeah,
that considered the biohacking? The resetting? Is that resetting? Is that considered biohacking?
You know, I think I've just recently come across that. Maybe somebody gave a talk about that, but I can't say definitively, but that does sound familiar.
Okay, thank you. I'll look more into it.
Yeah, I think I know how I've heard of it. I've heard some of these presenters out at these conferences talk about hack your brain. So not necessarily biohacking, but maybe similar, where they have these tricks that sort of help your brain do good things, get it on track or reach its potential, or, you know, those kind of things. They call it brain hacking, I think.
And then Tracy, from the article that you shared that I'm looking forward to reading, it talks about the ACEs, the adverse childhood experiences. There are all kinds of different things that just after like a quick peruse, like I pulled that was much more in depth than the bullet point that I put, but I put it in the chat, and it says the science of epigenetics, literally above the gene, proposes that we pass along more than DNA in our genes. It suggests that our genes may carry memories of trauma experienced by our ancestors and can influence how we react to trauma and stress. The Academy of Pediatrics reports that the way genes work in our bodies determines neuroendocrine structure and is strongly influenced by experience. Neuroendocrine cells help the nervous and endocrine hormonal system work together to produce substances such as adrenaline, the hormone associated with fight or flight response. Trauma experienced by earlier generations can influence the structure of our genes, making them more likely to switch on negative responses to stress and trauma. Yeah, I feel like that's a very profound. I'm sure that I didn't have a chance to read the whole, but just in perusing, I was like, that's a nugget right there.
I agree.
Thank you
And
for
as
that.
a Native American, I can attest to definitely generational trauma. And just to be, you know, genocide on any level, you know, it affects not just the physical, but definitely the mental and in utero, people, you know, women that are pregnant and what they're experiencing and the high levels of cortisol and everything that's going through and pumping through while you're carrying this next generation is definitely going to have its effects. And it's great to see scientific research and brain activity, you know, to be able to scientifically prove that is remarkable difference in how different cultures might handle different situations in our society, you know, and living on fear all your life, or living in, you know, that fight or flight, your that adrenal response, you know, you're exhausted, it's fatigue. And that definitely goes into our children and into our society. And how are you going to respond to, you know, social experiences, to getting a career, to going to school, you know, all these things that were expected of us, but we just are fighting for our life to get through every day.
Thank you for saying all of that. Yeah, Darlene.
Yeah, I appreciate you, Tracy, talking about that and sharing your experiences too with Evergreen. I am a person also who suffered adverse childhood experiences, and this is why now in my mid-50s, you know, I'm thinking for a number of reasons about my brain. And just so you both know, I shared this in the other group, is as I leave the Army Reserve, one of my goals as a more engaged community member, because I have a little more time now, is I've been going and, utilizing public comment at different meetings. So a local council meeting or the local school board or the library trustee meeting, giving feedback on, events maybe I've attended and thanking them for doing that, encouraging them more. But also particularly with the school district, because of research I've been doing, I was in the master's program at Evergreen in public administration. I'm taking a knee this quarter because I have bad knees. I need a surgery. But I did that as kind of, to learn more about the decision makers and such and how things get changed. But I was making a strong case for children learning about their brains from pre-K through 12th grade. They should be sort of the healthy masters of the thing that derives all the decision making we do and the emotions we have and so forth. So my theory, and some of it is backed by these folks with credentials who do the studies and who are watching children who are learning about cells, social emotional learning, and about their brain, is that children will have a buffer. So if they understand their brain and kind of how it works, and then they understand other people's brain and how it works, the bully in the classroom, the parent who may be a little dysfunctional, these situations that are adverse childhood experiences may not have the impact on these children because they have that buffer that says, wait a minute, these are brains at play, even my own, even how I'm reacting. Now, a preschooler is not going to be able to unpackage that. But if you lay the foundation along with all the other things you're laying the foundation of as a preschooler, kindergartner, first grade, second grade, it builds upon itself. And then children have agency. Their self-esteem may have a chance of increasing because they don't internalize all these crazy negative experiences that unfortunately some children have to go through. Mine wasn't the worst case, but I had enough of them. I know it changed my brain chemistry, what I went through. And so I am on that campaign, hot and heavy, going to meetings in public comment, crafting my statement. Some places you get 3 minutes, and making that case that here you go. Here are all these credentialed folks and other community members that run businesses that consult with schools on how to implement brain science curriculum in a way that's entertaining for children and helpful. And parents can learn too. Here are a bunch of free resources right on their website, all for free. And I'll just end with this because I get on my soapbox and my
Darlene. Yeah.
I will tell you, if you all remember the actress Goldie Hawn, I didn't know this about her. She won an award recently because of the work that she did. Now, she had money. I don't, but I would do the same thing if I did. Through her foundation and the money, she's earned. Back in 2003, and that's 20 years ago, she had a deep concern about the numbers of young people committing suicide. So she worked with her foundation and partnered with Scholastic. So Scholastic put out a lot of extra books and things for teachers and parents. And they came up with a 3-book series called Mind Up. And it's from preschool to 3rd grade. There's 3 of them. Mind Up. And it talks about brain science along with cell. And she won an award for that just like last month, of 20 years of this work. She didn't wait for people with PhDs to tell her, I mean, she didn't have to wait for school districts to go, this is so smart. Why didn't we think of this before? Why aren't we teaching children about their brain? That's the missing link here. She just went ahead and did it. And a lot of visionary people who have insight, that's what they do if they have the money. And I'm so happy that I see that when I go out and do my research. Does anybody else think this way? It's all over the place, but unfortunately, it's not everywhere just yet. And I wonder if that's going to help our children of the future to disconnect the stuff that we drag with us generation to generation, if it's possible. Okay, thank you for listening to me. Let me go on for a little while.
That was awesome. I think we have a couple seconds left. The Paper Tigers documentary, where they do the ACEs study with high school students. Have you all heard of that? I would highly recommend something about paper dragons. It was lovely sharing this space with you.
Thanks for bringing that up on your screen there.
Yeah, absolutely.
I'm with the Youth Advocacy Center of Lewis County.
Okay.
And it's my job is as a child forensic interviewer. So when there are criminal allegations of abuse, law enforcement and child protective services and prosecution send referrals to me to do an interview for the kiddos that's legally sound, legally defensible, and then I'm able to testify on their behalf in court as to what they say. And we offer, I mean, it's kind of just a neutral place. We're part of Monarch. I don't know where are you from? What's your?
Yeah, I am the mental health education and outreach specialist with Thurston County.
Okay. So I'm a satellite of Monarch Children's Justice Advocacy Center. I don't know if you know.
I don't. I'm like brand new. I've been here 3 weeks.
Are you a transplant? Are you from Thurston?
I am from Everett.
Okay. So the same area. Kind of sort of same area.
Yeah. I lived in Boston for the last 2 years while I was going to grad school. And so I just got back.
Nice. How is Boston?
It's good. It wasn't my favorite, but you know.
Yeah, I lived in North Carolina for a while and was very happy to come home to trees and mountains and water.
Yeah, I lived in Kansas for 6 years and I absolutely loved it. Like we actually tried to go back to Kansas, but it's really like Wichita, Kansas, it's really small. There's just not a lot of like job opportunities. And so I found something here, which was really great. So I am really glad to be back.
That's good. Do you work with the youth?
Yes. So right now my focus is on the youth, mainly like middle school. So we're trying to like get into the middle schools with Thurston County to talk about, you know, mental health, the suicide rates, that kind of thing.
Oh yes, our middle schools need it. They're kind of a mess. Yeah, we do a lot of we're working on getting some kind of training and health classes in our middle schools down here on exploitation and online safety and different things, which seems to be a really big contributor to a lot of the mental health issues.
It is. I actually just did a PowerPoint for one of my bosses about the impact on technology on children and especially young children. And it was very eye-opening. It's insane to see how like technology and social media have like really impacted, you know, everyone, but then also like exacerbated like everything when COVID hit. You know, it just kind of like it really has caused a lot of issues, I feel like.
Yeah, I do internet trainings for family or for adults. I do them at the schools locally. They do evening presentations for parents, and I do a lot on technology and trauma in our community. And then you know, we do, yeah, it's basically technology addiction, what's going on in families, and we get really good turnout for that because parents are kind of like at a loss. And you know, what we're seeing right now is that, you know, prior to probably like 4 years ago, when we had children perpetrating on children,
Mhm.
the idea was that the child who's perpetrating on the other child was being abused themselves.
Yeah.
And now that's not necessarily the prevalent problem. It is the fact that they're being exposed to violent pornography and unrestricted access to online exploitation.
Yes.
All the time. Like that's where it's coming at. So our kids aren't necessarily being,
Yeah.
they are being victims, but not in the traditional sense that for so long we've been like, well, if that kid's perpetrating on another kid, they're being perpetrated on.
Yes. Oh my gosh. Okay. That is crazy that you bring that up, because in my research, I literally have a couple slides on YouTube Kids. That like there was this one article where
Oh no, you froze.
What?
Oh, you froze. No, you're back.
Okay. So it was this licensed child psychologist, and she was like, in the past 5 years, I have seen so many young boys coming in because their parents have caught them doing like sexual acts on like their friends. And her thing is like, okay, well, I need to figure out if they're being sexually abused at home, like what's going on. And each time she's like, no, they were saying that they learned it from YouTube. And I was like, oh my gosh, like absolutely, that is crazy. And the fact that YouTube Kids is literally showing little children like malicious and sexual content is absolutely disturbing.
Well, have you heard of Elsa Gate?
I have not.
Check out Elsa Gate.
Okay.
It's so basically what kids are doing is they're watching their normal cartoons.
Yeah.
And and parents are, we're putting it on Mickey Mouse or Elsa. They call it Elsa Gate. Elsa, I think that was kind of the catalyst to recognizing this. But they noticed that, so the parents will put on a normal cartoon and the kids will be watching it, and you just click to the next one.
Yes.
Well, they were inundating it with they were changing it, and or algorithm, or I don't know how they justify it, but they were doing, it would be start with screaming in the background, children screaming in the background. They would add that, and then it would be shots, and then defecation, and then decapitation, and then burying alive. And they would incorporate this into the cartoons, and it would slowly desensitize kids to all of these different issues. And it was a psychological piece. So that's one of the first things I tell parents is like, you let your young kids who don't have the capacity to understand what they're seeing and talking about it, switch it over, and it's offline, like all of the things that you're watching, so what they're watching offline. But one push that I have been trying to find funding for is that because we have such this inundation of youth perpetrating on other youth, kids aren't pedophiles. They're not doomed to be pedophiles. But we have nothing for their parents, nothing, no resources. And the biggest thing that I think is the most effective is the problematic sexual behavior, cognitive behavioral therapy program for these kids who are being overexposed. But parents, I get so many calls and have so many parents of the kids whose kids are perpetrating. They're like, what do we do? Like, we need to do something. We need something for our kids. There's nothing. There's nothing for them. And this isn't just like, we need to like send them to mental health counseling. Like this is an entirely different issue.
No, that is, I think it would be so great to have your information so you could speak to my boss, because they literally like, they're really trying, or they're finding like the correlation between, screen time and watching these, like YouTube videos, linked not only to, the sexual, I guess like issues, but also the aggression and like ADHD and, decreased executive functions and stuff like that, which, it's a really big problem. And if they're learning it now at this young age,
what is it going to be like when they get to middle school, and what is it like when they get to high school and an adult? Like, how is that um how is that going to work, or yeah.
I'm pulling up my presentation right now. There's a study that has been done, and I don't know if you've heard of it. Where's it at? Maybe this is it. No. God, what is it called? I had it in my, is this it? Oh, okay. Let's see here. Where is it at? Oh, and I lost the link. Okay, so I'm going to try and find the link to it, but it's a study. Scientists, I think it started in maybe 15 or 16. But scientists are processing and monitoring 11,000 kids 9 to 10 years old. And the project is showing early signs of damage from the screen time. I think they study compared daily screen time use of 7 hours versus those who used it for 2 hours. And the children that used the screen times for 7 hours showed signs of brain cortex thinning. And then children who spent 2 hours still scored lower on thinking and language skills. So I'll have to find the other one. I have so many iterations of that. But now they've been going on for a while, and it's just a plethora of information on what they found with watching these kids and monitor these kids for a couple years.
Yeah, well, I would love to see that, because I did find another study where they were using EEGs on 2-year-olds, and they were finding, like, they put them in control groups of like less than an hour, 1 to 2 hours, 3 to 4, and then 4+ hours a day of screen time. And they found that, the more screen time that they had, their EEGs were showing that they had like less executive functions and stuff like that. But then they also saw it when they were like getting older, up to 9 years old. So they saw it before they were 2, but then it still continued. So that's really interesting.
Well, I mean, you think about it too, they're saying that now, so 90% of kids by the age of 2 have an online presence. And right now, 1 out of 5 children are being sexually solicited online. If you have that many kids who are 2 years old online and that inundated, they are being sexually solicited at 2 years old. They're being groomed.
Yeah.
Younger and younger.
Yeah. Well, and like the whole thing with TikTok, the fact that you can save videos, and people who are putting their kids online, they're seeing that more of those videos are being saved because they have kids in them. And that's absolutely disgusting.
Yeah, I mean, we're finding too, like we've been doing a lot of work on child exploitation this year, and bringing it up together our investigative teams on how to approach this. And we are dealing, and we're working with our juvenile justice, because our kids are doing it willingly. It is easy money. And they don't think there's anything wrong with it.
Yeah.
And, we have, especially, our girls, they're making easy money. And they think nothing is wrong with it at all. They've been so conditioned to think it's okay. I mean, it's just staggering. I had a case with a 9-year-old little girl. I worked on it with Homeland Security. And within a 2-week time period, a friend told her to go on Omegle, and Omegle led her to Instagram. Instagram led her to Pornhub. And she had a 2-week indoctrination into Pornhub. And then she went back on Instagram and made a bunch of friends, and was making videos of herself and using the language she learned in Pornhub to solicit men online. And mom found this out because she would do it during dinner. in the bathroom. Mom's making dinner and she would go into the bathroom and do this. And mom walked in on her, and, you know, mom called the cops. And I have never seen anything. I've never read anything like that came out of it. I mean, the 9-year-old, like I was I was shocked. Like I was speechless. I'm like, this is a 9-year-old wrote this. We're dealing with a 9-year-old online right now. I mean, we had cases. There was no way they were ever going to get these guys. You know, they were using VPNs, and we had some in Africa, some in Egypt, some in Europe, you know, all over the United States, but their VPNs are just bouncing.
Oh, wow. That is so scary.
2 weeks. That was it.
2 weeks. Well, and then, you know, it also kind of like brings up, I feel like, in the research about how those who do have a lot of screen time, or, you know, a huge presence on social media, usually are from parents who do have like a low educational background, which makes a lot of sense because, you know, like if they're not aware, you know, what makes them, you know, I guess like able to like tell their child about the dangers of online.
Right. It's navigating another society.
Yeah.
And you know, that's a conversation that we have with parents quite a bit, because they're like, well, I just don't know.
Yeah.
And I'm always throw that back at them. I'm like, well, let's take a look at what you're doing online. What are the kids seeing you do, and seeing how you behave? Like we need to step back and see what we're doing as well, because if we can't recognize our shortcomings in this area, we're never gonna be able to help our kids.
Yes.
And you know, they are smarter than we are when it comes to this.
Yeah, absolutely. I mean, I'm a millennial, and like I feel like I'm pretty like tech savvy, but not in this generation. Like they have us topped. And you know, so it's scary. Like I don't know, like growing up, I didn't think we'd ever be here, you know, like yeah.
I did work in college, not really thinking much about it. I graduated with, sorry, ignore. It was when MySpace was a big thing. I graduated in 2007. So I did I had my research published in 2006. And it was on technology and social norms and communication.
Oh, wow.
In the MySpace age, you know.
Yeah.
And I predict, you know, based on all of that, you know, I made a prediction of this.
Wow.
Because it was just the inability of kids to be able to communicate and have a conversation is missing important pieces. You know, they're disappearing. And I think that's a very big detriment to our kids moving forward, especially coming out of COVID.
Yeah.
And I was talking about this the last time a little bit. It's that I've been interviewing a lot of kids lately who have kind of this deadpan zombie-ness to them.
Yeah.
Like it's like a part of their communication died when they were isolated, and they're trying to like be reborn and figure it out again. And it's very sad. You know, just the connection, and even me just asking them when I start my interviews, I'm like, well, tell me about something that you enjoy doing, or tell me a little bit about yourself. Nothing. Crickets.
Yeah.
And that's not just in this scenario either. Like I've noticed it. We're a big sports family, and our kids play lots of sports. And I've noticed it with just the kids and on the teams. The way they interact with each other, the way that they have a hard time connecting, you know, when they're playing sports, and, you know, their you know, demeanor, just standing out on the field or doing something. And it's across the board. Like we're trying to like reboot our kids is basically what we're trying to do. And then we're expecting them to back off the technology, which we depended on for 2 years to keep them entertained.
Yeah. Yeah. So I guess like what are your you know, like just with your background, but then also as a mom, like how are you navigating, if I can ask that, like how are you navigating your children's, like, I guess, like technology presence? Like do they have phones? Do they have tablets? What are you doing?
Well, it's been a challenge for us, and I mean, I do this for a living, and I always tell parents, I'm like, just because I do this for a living and talk about this all the time doesn't mean I'm not experiencing the same thing that everybody else in this room is experiencing. And for a while it was nothing. You don't get technology. When you're 32, you can buy your own damn phone, but then we had to step back and be like, this is still a part of our world. This is still another world they need to navigate. And by us saying that it's bad all the time and trying to limit you need to limit it, but just trying to not even make it a part of our world is doing more detriment to them, because then they can't navigate it, because when they're 18 and if we cut them off, they're going to go straight to it one way or another. They're not going to know how to communicate in this platform.
Yeah.
So, a big thing that we have started doing is like you're not in trouble for the things that you find online. You just need to tell us about them. Like you're not going to find out, and making sure that we have that open line of communication. Like if something pops up, like on his school computer the other day, Pornhub popped up, and we've had conversations about what that means. And so he was at his grandparents' house and he took it and he said, this came up and I don't know what to do. So making sure that it's just an open communication and you're not in trouble. And I found myself, he was in the back seat the other day with one of his friends and they were giggling and it looked like they were trying to hide what they were doing. And I went to mom mode, be like, you better not be doing anything bad, blah, 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 blah. But that's not the right approach, because if they're doing something bad, I just made them think that doing something bad was not okay and you're going to get in trouble. And now you're not going to tell me about what it was. And we're going to have this spiral that goes out of control.
Yeah.
It's the same thing when I talk to parents about children who are experiencing abuse. They will give you tidbits of information and see how you react.
Yeah.
And if your reaction is always negative, they're going to stop giving you that information, and you're going to lose them.
Yeah.
And so that's been a big thing for us, is really coming to terms. Because if I could, I'd be like, technology be damned, go away.
Yeah, like with all my research, I'm like, nope, my kids will never be online. They're never gonna have a phone, because I'm just seeing all this information and just the scary side of like the technology, because like growing up, I mean, I remember when going into like chat rooms was a thing, and you didn't know who you were talking to, but you were giving them all the information, just all this stuff that I look back and I'm like, how am I not dead or kidnapped? Like, seriously, like, I cannot believe that's what I did. And, now as an adult who is thinking about having kids, I'm like, that is such a scary thing to do. And the fact that like you can't even post pictures of your children online because people are disgusting, that's even crazier. So
it's really just having that conversation, and I think what I find parents are having, it's like the kids are entitled to it. And there needs to be this switch in parents thinking of this, is these kids aren't entitled to this phone. This phone is not a right.
Yeah.
You are the parent. If they're not behaving correctly, then take it away and have conversations with them.
Yeah.
Set boundaries. There's no boundaries being set, and that's a really big deal. Like, shut it off.
Yeah.
I've had so many, and it's very hard sometimes not to go mom on my interviews, like especially with some of these older kids, and they're talking about like being harassed online and doing all of these things, and we're having the conversations, and in my head I want to be like, turn it off, power off.
Yeah. Well, and even for myself, like I've noticed being on social media really does give me a lot of anxiety. I remember when COVID hit, and I lived in Kansas at the time. I was a practice manager at a vet clinic, and we were essential. So I was working 50-hour weeks. we had two people in reception, myself and one other person. And, it was absolutely insane. And I got on TikTok and I just noticed like a complete change. Like I wasn't going to bed. If I tried to go to bed at a normal time, like I couldn't sleep. It was, and I just noticed that it was every time that I got on TikTok. And so I finally had to delete it. And, I actually just deleted like Facebook and Instagram and Snapchat and, all of those things off my phone because I was like, I'm starting to get a lot of anxiety again. And I know like me as an adult, if I'm getting that anxiety, there is other people, younger children that are experiencing the same thing, but they're probably, it's like maybe even worse because I don't know, like for me as an adult, I'm very selective, about like who I'm talking to. Like I have like 3 friends and most of the time we're texting each other, but it's like this digital age where young children are constantly talking to people on, those online sources. That has to be a lot worse.
And this misconstrued idea of friends.
Yes. Yeah.
Like, they're not your friends.
They're not.
You talk to this boy 4 times, you actually don't even know if it's a boy or like some bald guy in his mom's basement in California. Like,
yeah,
you don't know who this person is. They are not your friend. They are not your boyfriend.
Yep.
And that's a big thing. I don't have social media. I haven't had social media for 5 years.
Yeah.
And I don't miss it at all. And that's one thing that my son is not allowed to have, and he's 14, is no, he doesn't get social media. And part of that is I'm like, if you have something to say to someone, then you're going to say it to their face because you actually have to think about what's happening when it's coming out of your mouth.
Yes.
And you can't just go on with this misconstrued idea that whatever you say is just doesn't really matter. You can say anything you want because you're not having to look that person in the face.
Yes.
And I'm like, you are going to say something, then you're going to look them in the face and say it to their face because you're going to understand the consequences of that. Even like if you're going to ask a girl to the movies, guess what? You're going to walk up to her and you're going to ask her to go to the movies with you. If you want to text after that, that's fine.
Yeah, absolutely. I mean, I think it's important. Like I just, my friend, one of my friends, she has 2 little girls. She has a 3rd one on the way. And, just over the past, like, I think couple years for me, like I have noticed, just like I've been aware of, the like online predators and stuff like that. But I feel like in the last, I don't know, 7-8 months, I've become a lot more aware. Thanks to TikTok, like TikTok, bad, good. It definitely has given me like a lot of information just about the dangers of like what's going on. But that's like one of the things that I've really wanted to kind of like talk to my friend about is, because she posts her kids online and she will post them like, I think she has the little girl, she's in diapers, and she'll post like a picture and I'm like, please don't do that. Like, do not post your kids naked or, even if they're babies, because we have gross people on the internet and you never know where those photos are going to go. Someone can download that photo and then they send it and it's, on the dark web forever kind of thing. Yeah, so that's been kind of like I'm trying to find a way to navigate to have that conversation about like how important, like online safety is. Just because I don't think she's aware, of like the true potential dangers of like what's going on, especially when you post your kids in like vulnerable positions or outfits, that like it's fine when it's at home, but no, it's not fine online kind of thing. And I did read a study that says parents who post their kids on social media sites have a more lax approach in letting their kids have social media when they get older. And I was like, that makes a lot of sense. Like So then if they're lax, their child might be lax and they may not care what they're posting online, which then creates this vicious cycle.
Yeah. No, you're exactly right. And it's interesting how much pushback you will get when you're trying to bring that up to people.
Okay.
You know, it's like my friends know what I do.
Yeah.
And I am lecturing them all the time. I'm like, do you want your kids to come see me? Like, really? Is that what you want to happen? You want the FBI knocking on your door, handing them the tablet and letting them go wild so that you don't have to listen to them is not the best option.
Yeah.
But even when I can give examples, it's, that never my kid.
Yeah.
My kid would never do that. And I'm like, and when I'm talking, especially in the middle school, and I'm talking to parents, and I'm like, you can go, all of you can sit here and tell me your kids would never do that. And I will guarantee you they already have.
Yeah.
Like, this is nothing to them. Sending dick pics is nothing to them. They don't care.
They don't.
It's not a big deal until you figure it out and they're getting charged with, distribution because they're sending pictures.
Yeah. Which is, I'm sure, is a lot different than in my day because, those unwanted pictures, I'm like, seriously, like, no one wants to see that. No one. I don't want to see that. Like,
why is that okay? How did we get to the point where that was considered normal and okay?
Right?
We have an entire society online that is grooming our kids. That's what's happening.
Yeah.
They are grooming and it is grooming and desensitizing our children. And we're really just ignoring that fact. And the mental health issues that we're experiencing, they're from the online.
Yeah.
A majority of them are online caused. They are happening because of what's happening online. And we don't want to acknowledge that ourselves, because then we'd have to step back and look at what we're doing as adults. And so it's just this, it's not even being talked about in the sense that it should be. Like, it's this, let's talk about mental health. Let's talk about mental health. Let's talk about mental health. I was like, let's talk about what's happening online that's causing mental health.
Yes.
And there are other issues, but from what I see in the work that I do, that is the cause. And we're not teaching our kids how to deal with hard situations. And so every hard situation they focus on online, and there's a lot, they have no coping mechanisms to deal with anything.
Mm-hmm.
They don't know what the feelings are. No one's talking about the feelings with them. And so they're chalking up all of these feelings and anxiety and all these things being caused online. And we're medicating them because you have a mental health issue.
Yeah.
No.
Yeah.
I mean, yeah, we caused them to have a mental health issue.
That makes so much more sense. So, one thing that I was just thinking when you were saying that was how, oh crap, what it was like right there. No crap. I'll come back to it if it pops back up, but.
Well, if you want, I'd love to come and have a conversation and kind of go over the presentation that I give with your bosses and get input and get feedback and, and share it, and talk about getting it out, because it's a really big issue. And I don't know.
I would absolutely. Here, let me, I think I can chat to you right now. Oh, wait.
Here, I'll put mine in there, right?
Okay.
Oh, good Lord. It always does that. There's my phone number.
Perfect.
And then my email.
Okay. And then I'll just email you right after this so you have my contact information.
Okay. That come through forensic interviewer at Gmail.
YA forensic?
YAC.
YAC.
Forensic interviewer at Gmail. I'm always surprised at how many parents show up at this presentation. We were talking in the last one about getting people involved in these resources that we have and classes that we have for people, and no one ever showing up. And I get a lot. We get really good turnout.
Yeah. Okay. That's amazing. Cause we've been trying to, figure out a way to talk to parents, about the mental health concerns that we have for people in middle, or for, their children in middle schools. We're really trying to tailor it between parents and then children, just because like I feel like we need to give parents the educational like information, kind of like resources, like here's what to do if this is what's happening, kind of thing. But then also like providing support to children in school. So we're still like trying to figure it out. But I think, yeah.
I take a very direct approach. I no BS with
I love it.
And, I found like we're just going to get down to the nitty gritty and stop all this anecdotal phrase crap that you hear everywhere. And we're just going to talk about what's happening in our homes and what we can do. And I found that approach just works so much better because, they're just tired of hearing all of the buzzwords online. Like, oops.
Yeah.
So give me a call. I'd love to chat more, and
Perfect.
Totally willing to talk.
Okay,
Your
awesome.
bosses and
yeah, thank you so much.
I know it was a great little conversation. It was glad just the both of us.
Yeah, me too. Thank you.
All right, we'll see you in the next room.
Currently, our career and technical scholarship is open, and that's for like 2-year certs and like degrees. The application closes June 6th at 9 p.m. I believe, and it's really easy. There's no GPA requirement, and I think it takes like about 30 minutes to fill out.
Yeah, that's the one I promoted because that's my area. So yeah, it's always to see anything CTE specific or STEM. Yeah, so I'd be interested to find out the people who are receiving that and who have in the past, and what their fields were.
Yeah, I'll write that down. I think pretty soon we're going to start highlighting past scholarship recipients on our social media.
Great.
Yeah.
Good idea. I don't see any new folks in here yet. I know we are being recorded, and I know these recordings will be shared out. So I think let's go ahead and get started just with introductions, overview of the work that we do, who we are. We can drop in a chat because that will be shared as well, how to get a hold of us if needed. And then this can be shared out. So I am Kat Santana. I'm here as part of the Capital STEM Alliance with Dr. Lori Thompson, who's one of the hosts of the webinar overall. We work for Educational Service District 113, serving 44 school districts across a 5-county region: Thurston, Mason, Lewis, Grace Harbor, and Pacific County, with a focus on remote and rural youth. And of course, that includes all youth of all ages, K through 12, in connection to higher education. I'm also the executive director of Centralia Community Foundation, with my focus, my work in the community of Centralia. But all of it is about attaching and helping youth engage to higher education. And that comes in many forms. That can be stackable credentials, that can be apprenticeship, that can be college 2 and 4 year. And so that's why we have the wide variety of co-hosts here today to kind of talk about those. Some of us provide wraparound supports, programming opportunities. Some of us provide tuition assistance for our young people so that they can move forward and having great careers. Our panel is STEM, science, technology, engineering, and math. We can also call it STEAM and add the arts to that, because that is one of our STEM careers. And that's what we do. I am part of a team that is of Dr. Lori Thompson, Cecily Keister, and myself. We are free consultants working with education, community-based organizations, higher ed and learning, and wraparound supports to make sure that the opportunities we build for our youth have wraparound supports to help remove barriers from them being part of our programming and training opportunities. We do everything with a lens of equity to make sure that our folks farthest from opportunity are also connected to these opportunities, which is so important. Oftentimes, our remote and rural youth do not have the opportunities as our urban areas. So we want to make sure that we are building those opportunities as much as we can to provide hope for the future for our students, as well as putting in front of them people that look like them that have come up. So we heard Dale saying he in the future may start highlighting past recipients. And I think it's great for our students to see they can do it too, and that they of course are deserving of all the resources that we provide as service providers. So that's me, and I want to pass it off to my other co-hosts to introduce themselves, what they do with their organizations, and how they provide hope for our young people.
I went second last time, so I'll go ahead and step in. My name is Kayl Flint, and I am the project director for Equus Workforce Solutions. We are a part of the WorkSource umbrella, providing kind of investment opportunities for training for adults, individuals who have been dislocated work from the workforce, but also youth. We use local, state, and federal funds to invest into individuals and give them opportunities for training, whether that is through some formalized training or cohorts. Then, of course, you know, in those training investments, what we try to do is make sure that what we are using these funds for is in demand and is going to create opportunities where individuals are going to have a high likelihood of being able to achieve a self-sufficient wage. And STEM careers are very much a part of that list of those cohorts. So STEM is involved in a lot of what we are working towards in making sure individuals are trained up for opportunities in the future in Washington State and locally in our communities. So it touches a lot of what we do. And like I said, we work with youth in a youth program, adults, and dislocated workers. So, yeah.
I am Cheryl Brown, Executive Director of Grace Harbor Youth Works, a career connected learning internship program here in Grace Harbor. We work with all 14 school districts, been in existence since 2013, which we're really happy to say, especially through COVID. Just trying to help the students figure out what they want to do when they grow up. And we have a lot of fun working with the kids.
Cool, I think I'm next. Hi everybody, my name is Dale Baker. I am the promotional specialist at Washington State Opportunity Scholarship. A quick overview of WSOS. We were created because the legislature recognized the vast majority of jobs that led to income to sustain a family required some education post-high school, and barriers such as costs were preventing too many students and families from accessing higher ed. And so our corporate partners and investors were also experiencing a shortage in talent in our area that further threatened to erode our economies if employers couldn't find a workforce to fuel their industry. And so in the last decade, our state has become a leader in providing financial aid, and WSOS is also one of those resources. The Washington College Grant, which covers most of the tuition at a public 2-year or 4-year institute for families roughly making $65K, will cover a portion of tuition for families just making over $100K, I believe. But we still know that's not enough to cover the true cost of college, because you have to factor in things such as housing, food, transportation, just life. And so that's where WSOS comes in. Our flexible financial aid stacks on top of state aid and other federal aid or private scholarships, so a student can cover that difference. We have student supports like mentorship services and career training.
Good morning. I'll go next. My name is Desiree Chung, and I work for Juvenile Rehabilitation under DCYF. My position supports reentry from our youth, both in institutions and exiting our juvenile institutions. in our community facilities and then out into their own communities.
Welcome, Desiree.
Thank you.
And James, I didn't know, I wanted to provide you an opportunity to speak to what you do at SPIPA.
Yeah, let me turn myself back on here. Okay. Hi, I'm James Work. I'm the CTE STEM navigator at the South Puget Intertribal Planning Agency. And one of my main focuses is working on a newsletter that goes out every 2 weeks, 2 or 3 weeks, that is full of a mix of information, scholarships, educational opportunities. The last one I put out, there seemed, a lot of people aren't exactly sure what the difference between STEM and STEAM is, and found a wonderful article that really explained it very well. So, so just trying to promote CTE, STEM, and STEAM learning opportunities, and supporting both people coming out of high school and also adults either wanting to upskill or return to the workforce to find something that really fits well. And then I've surveyed all the programs in the areas and try to connect them to the best program to fit their needs that will point them onto a really meaningful career that with a decent income. And man, there's so many opportunities, and learning about new apprenticeships seems like every week, and man, those are really, really exciting. And so just supporting education and training and careers for our clients is pretty much what I do.
Thank you so much, James. Yeah. And I think all of us on this panel or not this panel, excuse me, this breakout session are very familiar with the term CTE for the work that we do. For anyone who is watching this recording who is not familiar with that, that is our career and technical education that is offered through our high schools and in our community colleges, higher education at large. And those are opportunities where students start to figure out what do they want to be when they grow up. And our schools work really hard to provide exploration activities for our students so that they can kind of get a taste of what's out there and what they may be interested in and how that aligns with who they are. And so I just wanted to make sure that anyone watching knew what CTE was. And then the last call or the last round that we had, we talked about, we're here to talk about STEM and career readiness, and we represent, career development for young people. Kayl has shared that she also serves low-income adults and dislocated workers. And what that is a dislocated worker is anyone who has lost their job through no fault of their own. And that can be serving folks who even have, or in addition to folks who have lost their job, been fired, laid off due to a wide variety of reasons. So for anyone watching this, this is not just about our young people, but this is about career development overall and what's available to us in our region. And Kayl at Equus is a wonderful resource for that. And guidance to wraparound services and career development itself. So I'm happy to have everyone here today. One of the things I realized as we were on break that I didn't I don't think we spent enough time talking about, and that's through no fault of anyone's, is we're here to talk about, mental health is and how we move forward together from what we've come through from pandemic. We know our young people always disproportionately struggle with the future, and we have had a dark cloud put over us that has weighed us down in many ways. Last session, we talked about, and I brought up how when we're looking at guiding folks in career readiness and into STEM careers, which are in demand, which means there's lots of them with a good projection of the future of sustainability and new careers growing all the time within these fields due to different initiatives, and clean energy being one of them. Our region is set to do biofuel and fusion energy and a lot of really new things. And we need to build workforce around that, which means we need to help our students understand what those careers mean for them. But one of the things I was said I was remiss in is we focus equitably in all the work that we do in helping build programs. And our region of these 5 counties is largely remote and rural. We do have a high population of Black, Indigenous, and people of color. And one things we didn't talk about is the intersectionality or the layers of barriers for our students and young people as they look towards their future. And so wanting to make sure that everyone knows that the focus that Lori and I do at the Capital STEM Alliance and our partner Cecily Keister is making sure that we're helping build robust programs. We have a lot of low income areas. That means that our school districts are often low income, lacking funding and opportunity. And this is where we come alongside, and a lot of you do too, come alongside with your services and opportunities for our young people to provide those, recognizing what those barriers are and spending time hearing from our students and young people what barriers that they are experiencing, because we never want to assume we know what our young people are going through. So I encourage everyone and any young people who may be watching this to reach out to any of our organizations and let us know what you in particular are facing. So as we build better for your future, that we have the opportunity to hear from you what you need. Does anyone have any questions or have anything that they want to share, or in particular information they wanted to glean to help serve the students and the young people and the different populations that you are serving?
I will add, I don't think that I mentioned in the last round, but it's actually been a particular focus for Workforce Innovation Opportunity Act to look specifically at mental health resources for youth. So looking at our programs that we implement, some of the local discussion has been, well, what does that really look like? And in talking with some of my my equals as project directors across different states, as how are you guys addressing that, and what can I glean to bring locally, is to look at how to create better assessments at the time of enrollment, where you could have maybe a really brief conversation. And we've seen a lot of these in our pediatric offices, where they're asking questions about, you know, have you noticed either yourself or your child, you know, being less interested in activities lately? And they try to do those assessments nice and early, is bringing some of those best practices into workforce development. As Kat mentioned last time, your head and your heart, those in alignment, doing better referrals and creating better referral networks to some local practices like community mental health or therapists that may want to partner in a deeper way. And I know we'll be probably facing some challenges in getting access, because there's a big demand on getting access to mental health services, sometimes wait lists, but I hope that just with making sure that it is a priority for us to be partners and connect, that will help create better through lines and get people access to services more promptly if they are disclosing things that maybe we should be connecting to mental health services. So I'm looking forward to that, because I think it'll be very enlightening and will open up a lot of conversation.
I appreciate that. Thank you so much for that, Kayl. There is a shortage, right? We know that, you know, my personal experience was trying to get mental health supports for my own children. I have a 12-year-old, 13-year-old, and 14-year-old daughters that I'm raising. And so when pandemic hit, it was, how do I don't know if I'm enough, right? You know, the world is changing, things are different, there's different problems and barriers, and to get my kids support. I also experienced, like a lot of folks, a layoff in the middle of pandemic where I switched gears. And so once we had, and I think this is a lot of family situations where we had, you know, some mental health supports, but then job changed, insurance changed, and we just start all over. That has happened twice. And so, you know, the lack of, you know, folks having care. I've always had someone who's had insurance. A lot of our folks do not have that opportunity. So also knowing what's free out there as far as resources. For those of you who are looking for some resources for your family and students, we have the panel. We have a panel of mental health supports. We have a panel, and I know that one of the folks in there is JP Anderson, who's the CEO of Choice Regional Health Network. And hopefully I'm saying that right. But Choice is doing a reverse referral where folks are coming in for their health and mental health supports. And there's a reverse referral where they're taking information to help guide them to housing supports for those who are experiencing homelessness and housing insecurities, to attach them, referral to workforce development programs such as what Kayl is the director of through the Pacific Mountain region and in our 5 counties, and just what's available. Also, our Hispanic panel is also support similar, but also those geared specifically for that community. And so I'm hoping that anyone watching that will also look out the other resources. We talked a little bit about, work readiness. We want to know, when we're looking at skilling up our students and our young people also, and Kayl mentioned it, where are they here mentally? Where are they in their hearts emotionally? Because we can skill up students and train them, but if they're not flourishing, they're feeling alone, they're feeling isolated, they're feeling disengaged, then they're not in a mental health state to make great choices, or maybe not feeling motivated just because of the circumstances that they're in. So one of the things we talked about in the last panel was, what are you seeing among the young people and folks in our communities? And we're seeing a lot of that. We're seeing folks, young people having struggles being engaged, and actually believing that that's just a lack of hope. And so what are we doing within our work to provide hope and opportunities to our young people? And I know I want to talk a second about intersectionality when it comes to barriers for those who are farthest from opportunity. We may see a young person come in for resources or part of our programming or applications for assistance that aren't feeling worthy. We may see them with multiple barriers. We oftentimes see students who are remote and rural, low income, coming from generational poverty, struggling with housing security. They may be of the LGBTQ community and pregnant and parenting. They may also have a disability, struggling with mental health. When you layer all those things together, you can see why we have the struggles that we have, that we're looking to assist our young people with, and a wide variety of programming that does that. I don't know if anyone would like to speak in particular about their feelings, what they're seeing in our communities, specifically the services they have to target those individuals or any specific populations, and with the work that they're doing.
I could try to take a stab at it. My role at WSOS is promotional specialist, and I navigate throughout the state to build relations and convince students to apply to our scholarships, and so that they are able to receive all of our opportunities and services. What a really big thing that we do for our students is our mentorship programs. And so once students are admitted into a program, if they're going through adversity or hardship, they have accessibility to someone who has gone through what they have. A lot of the mentors are students who are in like similar programs to them, if not the same one. Outside of that, since I do a lot of front-facing work and I am talking to students, and not every student wants to go into STEM, healthcare, or trade, or is even eligible for our programs, I have taken it upon myself to slowly learn more and more about the other orgs that I'm around and I table with. And so slowly learning and providing as much information as I can. I guess a good example of that would be I come across a lot of first generation students who parents immigrated into the state, and who may not have graduated from a Washington State high school. That's a big thing for our BAS scholarship for eligibility. But I know of other programs that help people navigate through the schools. And so I would just give like little recommendations here and there. Yeah, I'll leave who I'm thinking of in the chat. I can't remember the name off the top of my head right now, but yeah.
Thank you, Dale. I know a couple of resources I thought of during the break that I didn't mention last time, especially for one local to Thurston County is our ASHO, HASHHO, Cultural Community Center. Executive Director is Krishida Begum. That is a wonderful space of hope. There are so many programs being hosted through there. And I would love to encourage those for our BIPOC community. Thurston County had never had a gathering space, official gathering space before. And so that's a space for celebration. It hosts a lot of mental health and wellness events, a lot of connection to different community-based organizations that go through there that provide supports. I know the city of Olympia has done events through there around their career hub. Dr. Carlos Mejia, who is part of Michiantla, which means my home, working to serve youth who are struggling with addiction, substance use disorders, and also making sure that there's activities and opportunities for them to gather. I know there is different partners who connected to DCYF that host events through there. The True North program hosted by the Educational Service District 113 does similar supports, is hosting events through there. And so I would say definitely check out the community calendar for ASHO to see what is going on. And of course, you know, it's open to anyone outside of it, of this Thurston County. It is based in Tacoma, or excuse me, in Tumwater, but it's a regional space for everyone to be utilized. So I just wanted to make sure to share that out as a gathering space and a space of connection for young folks. It's really good.
Thank you. I didn't know about ASHHO.
Yeah. And you know, it's also a space, Krishida Begum, who's the executive director, is as a well-known speaker and will travel and educate our communities on human trafficking. So
wow.
That's another resource there. So it's great.
Check them out for sure. Yeah.
And Desiree, I don't want to call you out, but I see that you're here and I'm really excited. A lot of the work I've done in the past in workforce development has centered around serving our justice-involved youth and building work-based learning and training opportunities within juvenile facilities and community facilities. So I'm glad to see you here, and hopefully some of the information that we are sharing today will help with those that you're serving in a reentry space, which is something that I'm very passionate about and near and dear to my heart. So would love to connect off of here to see what supports we can offer, as well as everybody here.
Yeah, no, that's great. We actually have a post-secondary administrator that's on our reentry team too. You know, just working in that educational space. I have had the pleasure to be working with Kayl and her organization in our facilities. Sad to see them go. But they've provided great service for us and for our young folks. And so, yeah, I would love to continue the conversation. Absolutely.
Yeah. And then Dale, I wanted to ask specifically, I know that the scholarships are open to everyone. And I know in the past, we have helped students get tuition and scholarship through you who were currently incarcerated, or working or now living in the community facilities so that they can plan their future. So talk to us a little bit about that. I mean, how, the equitable portion of the Washington State Opportunity Scholarships in serving all youth, including those who are currently incarcerated.
Yeah, I can't go into super depth because I'm still relatively new to the org, but that is something that we're trying to do. I know upcoming, I'll be visiting some like juvenile centers to present and like help students navigate. But what's really cool about the scholarships is that we don't do like a background check. We understand that stuff happens, but that isn't taken into consideration of who gets scholarship or not, because everyone is deserving of it. Yeah. Do you have any other like specific questions that could kind of help me guide a better answer?
I just wanted to really highlight that, the opportunity for the young men and women and young people who are in our juvenile detention facilities do have access to this scholarship. And I know you had talked about before, I know through working with youth who have been incarcerated or just as involved, that helping them up, and a lot of times there was that feeling that you spoke of in our last session where young people are saying that they don't feel that they're deserving of such opportunities, and really encourage them to take advantage of it because they absolutely are deserving. And I think it does a long way to reducing recidivism, is helping them have a bright future and have the training they need to get into great careers. So, and again, with your focus on career and technical ed and STEM, a different STEM careers within education, that it, they're not banned from these things. They're not banned from these opportunities, and we would love to see them partake.
No, yeah, for sure. I think it's going to be a slow process because it feels like we are like chipping away at like a bigger systemic issue that leads these students to feeling like there aren't opportunities to them. But slowly but surely we're flooding like current pipelines and I don't know how to say it, and we are changing people's state of mind. I was trying to think of the word. It's hegemony, I think. Hegemony. Yeah.
I appreciate that. And I think, we have so much opportunity, like I spoke to earlier about those, intersectionalities and our students and just people in general pushing through multiple barriers. It's not just our young people, but a lot of the work we do is focused on them, right? Providing opportunities and to see them successful. I know Kayl talked about in the last session about different things we can do to help our young folks be brave, right? To just try the opportunity to get out there. And that's one of the things that we've really been struggling with, is there's a lot of anxiety, social anxiety. There's a lot of fear of the unknown. And the world feels upside down. I know we're on the more engaging, physically engaging side of this pandemic. It's still there. It's still present. It's still affecting and impacting people largely across not just their health, but their careers, even education. And obviously, again, mental health is one of the big reason why we're here gathering and having these conversations today, to find out what we can do for our students. And Cheryl, you've been pretty quiet. I don't want to call you out, but you have done a lot of wonderful work with the students in Grays Harbor. We talk about our different communities. There's different impacts. We heard Carolina, our commissioner in Thurston County, talking about the unemployment rates in Thurston County, which is over 4%. But we have communities, I believe, presently, Lewis County is close to 9%, and I believe Grace Harbor at 11%. And I know that that is huge impact to our students and holding hope. And I know that your programs are so fun and engaging. You've done some amazing things during pandemic. You did not let it slow your work. You were the first organization I knew that came up with switching everything you did, including your internship opportunities to virtual, to make sure that your students in your community did not lose out on opportunity. Can you talk about why you felt that was so important to make sure that those opportunities continued and how that's kind of shaped your forward work?
Well, 2020 for us, it ended up being pretty good. You know, when we lost our businesses and students, I thought I lost my job. A week prior, our program manager at the time, Felicia Mullins, had gone to our board and said, hey, she was big into social media. She has a huge Twitter, Facebook, all that. And I'm like, yeah, I don't know anything about all that stuff. Then when she got board approval to let's do an internship on social media, it's a high demand future career field, right? We got approval, and then like 4 days later, COVID hit us and everything shut down. So we pivoted in 24 hours. We had a career pathway day lined up where we take our 2 or 3 high schools and we divide them up by career clusters and we ship them to the college. They do a workshop and then we take them out in the field and they visit 2 businesses within that career cluster. Well, we went to all those business hosts and said, hey, we're going to do a career connected learning Zoom series. And everyone said yes. So we had it booked in 24 hours. We started that following week. ESD 113 told them what we're doing and they helped blast it. And so we really don't know how we impacted, but everybody was still kind of scared. But we were able to provide a way of students and other adults to look at something, even though the world's really scary right now, but this is what people are still doing. And that launched us into our STEM project with WACWA. It was an outdoor project. We had 6 students start. Now, last year we had 45 students from 17 out of Grace Harbor County. Then we did Lake Quinault 8th grade science class. So he used that class as a to his robotics class. And then the science teacher in Tohola, we worked with his 4th grade class. So that was like really huge. We did a lot of traveling. And then we also was invited to help with careers and natural resources with the Rainier. They were doing doing logging behind the Wish called Valley High School, and they didn't know how to get a hold of the students. And so they went to PEI, which Pacific Education Institute, and then they told us about it. So we just did our 3rd or 4th year. And yesterday was our last excursion for the year. The students learned how to do land surveying, and it's been a pretty cool thing. So by keeping the kids engaged, we are finding before we used to go to the schools and present, and now this year I could say at least 75 to 80% of our students have come to us.
Well, welcome everybody. Perhaps we could start with introductions, say your name and what organization you work with, if any at all. Moriah is co-hosting with me, so let's start there.
All right, I'm Moriah Candler. My pronouns are she, her, hers, and I am with Big Brothers Big Sisters of Southwest Washington. I'll pass it off to Maria.
Hi, my name is Maria Huang, and I am a pediatrician in Olympia.
Aubrey.
Good morning. My name is Aubrey Schlattman. I use she, her pronouns, and I work with the Department of Children, Youth, and Families mainly in the Education and Training Voucher Program.
Is that STARS or another education training? Licensing?
ETV, post-secondary financial support for youth.
Thank you. Alexis?
Hi, my name is Alexis Hood. I use she, her pronouns, and I am the Family Resource Coordinator and Booth to 3 Program Supervisor for the South Bend Early Learning Center in North Pacific County.
And Jeff?
Hi, Jeff Wilkie here. I'm retired in Olympia. I'm a volunteer bus buddy.
I love that. I'm gonna start putting Bus Buddy by my name. I just like the name of Bus Buddy. Welcome. In our morning session, our earlier session, we talked about thriving post-COVID and what were some of the challenges and some of the strategies that might help families thrive. Any thoughts about some of the challenges that you're seeing, or maybe some of the strategies you've already employed or seen employed that might make a difference for families and children in our community? Bus Buddy sounds like a good one.
What is the Bus Buddies? Like, what does that entail?
It's a joint operation between the Catholic Community Services and Intercity Transit. And it's basically helping people get around on this bus system. Put in a lot of hours, but most of that's trying to recruit more riders. A lot of senior citizens want to take our want some help getting to their appointments, for instance. We'll just tell them what bus and we'll be along with them and so on.
Oh, interesting.
In our earlier discussions, we were talking about some families really struggling post-COVID with high anxiety, depression, and unfortunately couple that with isolation. Then we have some pretty dangerous places for kids to navigate. And strategies that were raised to kind of address that in that earlier session included things like having a one-stop shop. People could go to a website to say, what could we do for us today? What are resources in the community, especially in summertime when families do disengage from one of the primary sports, which is the school. We had a person from the library that was with us, and man, they're offering a lot of stuff at the library. They no longer fine you, and they have all these outreach programs that they're offering. And you can even go rent or borrow a backpacking kit for your family or a fishing kit. It comes with a pole and bait and everything. So some really great things happening in the library.
And free printing.
And free printing, yeah, up to $44 worth of free printing a month, I understand.
Right.
Yeah, yeah. Somebody called me from Elma actually and said, I need to make copies. There's no copy store. Any suggestions? The library. Great resource. One of the challenges I wanted to bring up in one of our sessions today was what I'm hearing from schools and families around the transition post-COVID up in grades in schools, that families and kids are not coping well. There's sort of some rites of passages that were missed when a third elementary school would have typically moved into a middle school, and instead of getting that 6th and 7th year, they're going straight into 8th and struggling with maturity levels and independence, and true with some other transitions in school. And I'm wondering if other people are seeing that and what suggestions there might be to address that. Just me.
With youth in our programs, we've had, I would say, most kids seemed more nervous about making the transition into middle school than into high school. That middle school transition was scary. They were really nervous about making it to classes and have to change classrooms. And then the transition from middle to high school sometimes a little bit nerve-wracking, but it seemed like less so. But what I noticed coming back from COVID is that all of the kids seemed nervous about transitioning back into school. And the ones that were going and starting high school, the level of nerves and uncertainty was more like those students as they transitioned into middle school. So it kind of made the transitions, I think, even more challenging for them.
Yeah. Yep, and parents too.
Yeah.
Although we work with a lot of relative caregivers, grandparents who are raising grandkids in Washington, 46,000 grandparents are raising their grandkids. for every one kid put in foster care, there are 20 that go live informally with a family member. So I know COVID was really tough on them. They didn't expect to spend their retirement caring for kids anyway, and now they have them full time and they're teaching school. So there was a lot on their plate. We're offering weekly support groups and some concrete goods, but I know in our earlier session, one of the things we talked about is that sort of internal dialogue people have that we call chicken little syndrome, where the sky's falling and everything is sort of spun in a very negative way. And the value of reframing and helping people sort of find that attitude of gratitude, the silver lining, and how that has worked to defray some of the stress. One person in the last session talked about mindfulness, promoting mental mindfulness. Any thoughts or strategies that people have seen employed that will bring that anxiety level down? Or maybe what we could be doing in our community.
I'll add, I know in our practice, we know that there's evidence that exercise and activity really help with mental health. And so I think really getting kids outside, especially in the summer, finding parks and places that they can run around is really important. And I don't know if you know, but you can get a free national park pass for every fourth grader. And so we're encouraging that. And there's a new initiative to write a prescription for play, like just go play outside.
I love that. You know, Dr. John Medina talks about mindfulness, but also puts out a really great, well, he wrote a book and does a video, but really great message about moving. Get up and move, and it brings that positive dopamine or endorphins that just helps you look at things in a little positive way. We've had such increases in road rage and people not waving with all their fingers that I think anything we can do that's going to make things a little happier is going to help. I love the concept of move. Oh, thank you, Aubrey. Is this one you've seen employed or you worked before? She put something in the chat box for us. Oh, that's great. There's a link in the chat box. I'm going to put ours into when we first began talking this morning. Sarah mentioned the QPR training, question, persuade, respond. We had in Thurston County 2 9-year-olds commit suicide within relatively close time frame, which seemed very young and very too many. And we wanted to see what we could do. And we, as a community, researched the QPR curriculum and implemented it. And now it's offered for free several times a month. This 90-minute training anyone can take that would help you be better prepared should someone show signs of suicide. We talked about this morning also exploring a curriculum that some hands-on museums have incorporated for their staff that just says when you're with a family and it seems like things are tense and it's going to go bad for the kid, here's what you can do to not make it worse. Here's what you could do to help them navigate that situation. And we looked at what perhaps we could do in our community to offer that in a broad way to folks. Thanks, Moriah.
Yeah, I just shared some various resources that we collected over the years. So I shared that. I'm also going to share, we have an upcoming workshop with an author. She's authored 2 different books it's for parents, but it's really for anyone who works with children or is around children. Her books are called How to Talk So Kids Will Listen. And her second one, I think, is How to Talk When Kids Won't Listen. It really, really focuses and addresses how we are interacting with children developmentally with different ages and different abilities and how to phrase what we're saying. This is an upcoming workshop. It's a 4-week workshop. Each session is an hour and a half long, and it's totally free. It again is geared towards parents, guardians, or anyone working or interacting with children. So I'm going to share that in the chat. Please feel free to share that out. It's all virtual, it's all free, and folks who sign up will get sent a book. We'll get sent the book as well, so they'll have that. And our staff are going through it now, and it's been a really, really good training opportunity.
One of the services we offer for the community is a class called Consider the Children. And when you go through a divorce or separation, the court mandates you take this 4-hour class before they grant the decree. So we see quite a few parents, at least about 1,000 a month, going through separation or divorce. We serve multiple counties. And what we are certainly hearing from parents is it's a very stressful time. And I like we haven't woven in a conversation about moving, getting up and moving, or taking a walk with your family. We'll definitely weave that in to our stress management piece. But we do see these families in these intermittent, very stressful places, whether it's a baseball game coming up or navigating, moving in or out, even exiting from school and then coming into summer could be very stressful for families. Any thoughts on how to raise coping ability? Anything we could do collectively as a community? Thank you, Moriah.
I've got two sessions I've been there. The first one is for professionals, and the second one is for parents and guardians.
About hot spots in the community, anything that you've seen you're concerned about that we could address as a community? I know we've had a lot of conversations about the homeless population and how people are able to access housing. Are you seeing that in the worlds that you traverse? No?
Yes.
Yeah.
I've heard of 2 flexible funding sources for housing recently. So I was gonna look up those flyers and see if I could share them.
Yeah, we have a small housing fund based on children in the home, and we gave out over $200,000 in the last 3 months in housing at and helped 500 kids stay housed. But now our funding's gone, and so we have some anxiety about what families will do next, especially with school being out.
I mentioned this in the morning session, but I love this venue where we can talk about all the resources and great things that everyone's doing, because I feel like there are groups that are doing great things, but we just don't know about them, or how do we communicate that? So yeah, I feel like it'd be really helpful for providers if we had, like some sort of booklet or list or something when a family comes in and struggling with, divorce or homelessness or these sorts of things, that we could have something just really concrete or, right away that we could share. Because sometimes it's hard to, search for things or know exactly what these services provide. So it's hard for us to encourage them when we're not really sure what you provide with these services. So yeah, I feel like that would be something that's really helpful.
Thank you. And we've talked about this before too. We need some kind of a liquid document that can take the ebb and flow of resources as they come and go, and some qualifying factor like this one's free or
right,
has 3 stars. Definitely there's a group that will be working on that. In the meantime, one of the things I know my agency and we partnered with several others have begun offering these resource fairs. Basically, what you're talking about is presentations for the community on what is available, and then giving out a whole bunch of swag to make sure they remember us. But we partnered with CMAR and Big Brothers Big Sisters and Boys and Girls Club and Molina and all of the maybe 20 or so folks, and put on these resource fairs all over the community. So we're bringing the resources to people instead of asking them to come to us. If, Maria, we can help bring some resources to you, let us know. We've gone before several, we just were at Capital Medical Center, for example, or yesterday we were at the Nisqually Tribe sharing collectively what we could all bring to the table. It might be a one-stop shop for your team. But
yeah, that would be great.
The idea of having a website that we could all go to say, add to the calendar this event. I know next Saturday is the Duck Dash, and after that is the Relay for Life, and many of us will be there handing out stuff. But where's the calendar? What's going on? Yeah.
Together has put out a community resource list, a crisis Connections has as well. Although I haven't seen it. Shelley, have you seen an updated? No, it's been a couple years. So I'm going to share the ones in the chat, Maria, if you want to grab any of those. Most of those resources are still active, but some of them might be a little outdated because I haven't seen updated ones recently.
Great, thank you.
Yeah.
And I know we have a calendar on our website that I put in the chat. And do you have one too of Big Brothers Big Sisters?
No. Not accessible, just for our participants. Yeah.
The other thing we launched into that right around COVID time was Parental Compass. We had so many people in our pairing classes, and when COVID came, they sort of dropped off. I think everybody was Zoom tired, you know. But we were able to put together Parental Compass, which is a series of podcasts. We were able to record amazing speakers who weren't flying around anywhere, who would have cost us thousands of dollars in any non-COVID year, to do these little 10-minute inoculations on some a variety of topics. So how to navigate LGBTQ plus children who are identifying differently, or how to get them to do their homework, or tell them about COVID, or have the sex talk. All of those things you could find on that website for free. One of the other things, maybe I already said this, that came up this morning, is just doing our best to be personally in a good space and invest in self-care so that we're less reactive to other people who are not in a good place, and promoting mental wellness instead of feeding mental illness.
I would just add to that to underscore the importance of sleep for kids and for adults, just how much we can handle better when we get enough sleep. And that kind of ties into what I talk to teens about in terms of social media and their phones, and how that can really sabotage sleep at night when they have their phones in their rooms, or the messages are pinging and they're not sleeping well, and we know, of course, that ties to increased anxiety, depression, things like that. I would love to see, I know in Seattle, and the Academy of Pediatrics has really pushed for high schools to have later start times, so kids can get the sleep they need. So I know some schools do that and others don't, but I'd love to see that happen if possible.
Yes. Dr. Mary Sheedy-Kurchinka wrote a book about the importance of sleep at every age, and if we aren't helping our kids to sleep, how it changes their brains coping mechanism. And all of us, I think all of us. in the early, I feel like I'm a live advertisement for the library, but one of the things that they shared that I thought is going to be so much fun this year, and maybe Moriah, you heard more than I did here, about their storytelling books that they pulled apart and made them into walking trail books. Is that what they called it?
I don't remember the name of it, but yeah, they deconstructed story walks or something like that. And so they take easy short stories for children, and each page basically is on a little placard along an accessible trail. And they have them in all the counties that they serve. They said they're going to have the list up on their website soon. And I don't know if any of you have come across those. I was telling the group last time, I actually came across it just out in the wild with my niece and my nephew, and they just had a blast running from sign to sign, you know, trying to find them all. But a lot of good resources there. They also have library of things, so you can check out a bird watching kit for for kids, but they also have one even for older, adults too. Yeah, bird watching kit or backpacking or bug finding or all kinds of really great resources that you can check out, physical items from the library as well.
Yeah, I like it that it got families out and moving, and they spoke that some of the stories had I Spy games. So along the way, you can engage in a very positive way and then go on to the next one.
They have Discover passes too.
Thank you. And at 4th grade, you get a free Discover pass, right?
No, Discover is the statewide one. The 4th grade one is the national parks.
Ah, so our Discover pass is free?
They're checked out.
Oh, from the library.
Right.
Yeah,
Oh.
you can check them out from the library. You can also check out tickets and passes to museums. The museums and the History Museum, I believe the Glass Museum.
Wow, I didn't know that.
Yeah, and I can't remember, maybe the Art Museum, but I don't know if they still do the Tom Art Museum. Yeah, but you can check those out from the library as well.
I know the Hands-On Museum and the YMCA have been generous with us, and they've given us a bunch of passes to hand out to folks, and we're kind of doing it left and right. Back to what Maria was saying, getting people moving and socially connecting. I think isolation is one of the risk factors that we're facing now, and so anything we can do to help connect folks so they have informal supports in times of crisis. On August 5th, we'll be hosting a cornhole tournament at the Centralia College. So there's one way folks can go out and have some. I didn't realize how popular cornhole was till we held a little tournament in January. And we learned that Rochester is the cornhole capital of the United Nations. That is where people go to sign up to cornhole. I did not know that. Very popular these days. It's a good way to get people out and moving though. Any other thoughts on needs or answers? No.
What are you all doing within your workplace to address, some of these same things, the mental health of, staff and other people in your workplace?
I said in the last session, one of my staff went and picked up these free, when you get flowers, they give you these cards. And I think she cleaned out Safeway, but she went and got a bunch of these cards and leaves little positive notes for people. Mindful notes like, thank you for opening the door for someone, just small things that make a big difference for folks. We're also very intentional about trying to find opportunities to recognize when people are doing great things. And someone in the past session talked about that mindfulness and how they start the day, their entire staff start the day trying to find something kind or positive to say to each of them before they begin. And Moriah, you talked about having a staff meeting and doing similar.
Yeah, we do morning mindfulness on Mondays. Monday morning mindfulness with Moriah. I put as many M's as in there as I could. It's just open to all staff. It's just we do a short mindfulness exercise and then a time just to connect with each other. And some of us are remote and some of us are in person. We have various offices, so it's kind of turned into like a morning chat as well after the mindfulness and kind of sets the tone for the week. Just to make that kind of in-person connection. That's nice too as well.
We were doing French toast Fridays for a while, but we turned a little health conscious and now it's salads.
I don't know, the French toast sounds pretty good though.
It's making me hungry.
I'd love to see like mindfulness and breathing techniques incorporated in schools, like in each classroom. I think I've heard about that pilot in Arizona that has worked really well. So I don't know how to make that come about, but I think that would be really helpful for kids starting at a young age, learning that and taking it into middle and high school. I'd love to see that happen.
Yeah, it is that road rage, anger management sort of ability to filter your emotion, regulate yourself, that I see kids who have missed those couple of years in school are really acting out on that self-regulation piece that we could do more work on, parents and kids. I love that. I'm going to check out the Arizona model. Maybe we can help our schools implement something.
Maria, what changes have you seen in families coming to you or, within pediatrics of mental health concerns for the younger kids?
Yeah, I mean, since the pandemic, most of us, our visits, probably 50% of them are mental health visits. And, all our well checks involve something to do with mental health. So it has definitely exploded, as probably everyone knows, the youth mental health crisis. And we are seeing that more in younger kids too, like anxiety at a really young age, even with preschoolers who were born during the pandemic. We're seeing a lot of social emotional issues, like families who didn't leave the house, who didn't even go to the grocery store, and these kids are very fearful. So we're referring a lot to birth to 3 and just getting them in for some social emotional education and playing with other kids their age.
Yeah. What do some of those changes look like in developmentally pre-COVID and then developmentally now? Like, what are you seeing as some of the indicators that this is would be concerning for you for those younger ages?
Yeah, I mean, some are pretty severe. I just had a 3-year-old come in who was just deathly afraid of even being in the exam room. Both her parents were there. Anyone who walked in the room, she was just unnerved, screaming, really hard to settle. And her parents said, this is ever since the pandemic. I mean, she's never been out. She's never been really on play dates with other kids. She's an only child. So, I mean, that's pretty severe, but we're also seeing issues with sleep, and a lot of separation anxiety. And even in the younger kids too, often they complain of stomach aches, headaches, things like that are probably more stress related or anxiety related than anything else. So I think what we're seeing is just happening. What we used to see in elementary school and middle and high schools are now, preschool and 2 and 3-year-olds are showing these signs. Which is concerning.
certainly seen those somatic complaints come out. It used to be just around 3 or 4, and we're seeing more as the kids are aging. I mean, I didn't see it as much in teenagers as we are seeing it today.
And the sleep issues, I think, are huge.
Do you have a sense if that's coming from social media or just overall stress? What I'm asking because we had some kids we talked to some parents about not having kids take their phones into the bedroom at night. And I'm wondering if it's social media or just overall stress, or maybe both.
I think it's both. I definitely recommend, no screens in the room like an hour before bedtime. Obviously, when teens hear that, it's like, that's impossible. I can't do that. But I think it's both too. I mean, I think for the younger kids, it's stress they're feeling from their parents, and even though the parents may think, gosh, we're keeping things under control, kids are really good at sensing those things, and I think they feed off of it. So just being really careful about talking about financial problems or things like that when the kids are around and listening, kind of body language, things like that. I think I've been seeing that's affecting the younger kids more.
Yeah. Not only being aware of your body and your communication, but your own self-care, and
right.
knowing you're in a place where you don't snap back, but you can respond. Okay, I think we're going to be rolling back into the main session, maybe just a little bit early, unless there are final thoughts. Anything you'd really like to see, or other than what we've already talked about, which is a one-stop place to go to get the resources and to share with others what those are. Any other wants or needs? And I will thank you for joining us today for the entire event and contributing, and we'll see you back in the main area. Moriah, anything?
Meet you each.
Okay.
Like last time, we're just going to go around and introduce ourselves so we get the lay of the land of who's here. So I'm Megan Darrow. I'm the executive director of Together. We're a youth serving nonprofit focusing on place-based wraparound services for youth in schools. So we have a social work program where we have case managers in schools who are connecting with youth and families to do wraparound supports. We have a youth housing program for unaccompanied minors, connecting homeless youth to host, volunteer host homes in our community. And then we have an out of school time programming that also provides 200 youth wraparound services and social emotional learning and academic help in North Thurston. And that's me. So let's just introduce everybody.
JP, did you want to go first like last time? Or?
Hi, JP Anderson, CEO at Choice CPAA. I was in this breakout last time. This is an area I'm super interested in and wanting to hear from folks on. We do a lot of wraparound and community-based services in our region with a host of subcontractors for our organization. We've got a lot of work in this area going forward with the new Medicaid waiver, building a community hub infrastructure intended to build and support a social care network that really takes dollars that are originating from healthcare and moving towards those preventative services that we know happen best in community and best by community-based organizations that are led by people that look like their community, are from their community, and oftentimes in doing that, focusing on equity to make sure we're promoting some shift in power dynamics to bring more people to the table to do that work and to have voice on how those funds should flow into the future. So I think of it as the missing third of healthcare. I'm a social worker by trade. I was a public health director during COVID and just want to listen. Thank you guys for letting me jump back in this group.
Hello, I am Brady Figueredo. I'm the Director of Operations for the Moriah Group, and this is Tanikka. She's our executive director of the Moriah group. There's a question real quick. I'll just talk about who we are and what we do, and then I can answer that question if you want. But the Moriah Group is a nonprofit organization here based in Aberdeen. We have a second location in Alabama, but we are a nonprofit organization that is focused on wraparound services for people in recovery, abuse, abandonment, trying to provide hope for the community and providing a place where people can thrive. I know I didn't do our mission statement exactly word for word, but close enough. And we provide workforce development, financial wellness classes, recovery areas, housing, several different. We're working on lots of projects, and that's a bit of who we are. I didn't say this last hour, but I'm pretty proud of it. But last year we were able to reach almost 1.8 million people through the United States and in 7 different countries, I believe. And with services, goods, so just a ton of different things going on. We have a housing program, a recovery cafe, workforce development, and a warehousing and logistics program. We're going to hopefully be expanding into a food program through our workforce development, financial wellness, and just a bunch of different things. Why Tanikka is not here and I'm here and you get to see my pretty face is because they're doing a master planning meeting right now on some developments that we're hoping to bring by the end of 2026, bringing about 200 units to the Grays Harbor area, in Aberdeen and Hoquiam combined. And then, yeah, that's us. And then Lori, wraparound services. And I think Megan has a great explanation as well, but how we kind of view it is a wraparound service is a service that if you imagine a person and they have all the barriers and if it's from food or housing to recovery to medical, SNAP benefits, medical services, doctor's appointments, or anything like that, we're trying to provide a service where they can come to us. We're the one stop where we can refer people out to recovery facilities, services, doctor's appointments, financial wellness with our partners, and Twin Star, and then our housing program, reentry program, and tons of other things. So we're a wraparound services to address those barriers and help people navigate how to get to those services. Meet people where they are.
Who wants to introduce themselves next? It helps to start the conversation.
My name is Angela Hawley, and I'm from Timberland Regional Library. I'm a library assistant in Elma, and I'm really curious by what Brady meant by 200 units coming to Aberdeen Hoquiam.
So it's already been in the newspaper, so I can talk about it. It was in the newspaper before we even knew about it, but huh? Go ahead. Oh, okay. So we just recently purchased a hotel in Hoquiam that we're going to be transitioning. It's 27 units and then two bedroom units, right? Yes. And we're going to be transitioning those. Construction hopefully starts in the next couple months, where we will transition those 27 units into studio apartments. Hoquiam is completely on board. They're already they're super excited about it. And then there will be two bedroom units. We currently own 29 pieces of property here in Aberdeen. We purchased it a year ago in May, and it comes with 17 houses. The master planning meeting that was going on downstairs, that's why Tanikka wasn't here, it was to discuss our larger unit. If you're familiar with our building, where it's located, it's the old Middle Swansons for anybody who's from Grays Harbor. And we have two pieces of property that are next to our building. That's where our larger apartment complex will go, which will cover about 90 to 100 units there. So that's where we're going right now. So
And so, sorry, the intent is affordable housing.
yes, affordable, sustainable housing, low income. Currently, the houses that we have that have renters in them, we are transitioning those into affordable, low income housing as well. Unfortunately, when we did purchase all these houses, they were owned in a trust. That's why we had to purchase all 29 pieces of them, and the previous owners really didn't take care of them, so we inherited some difficulties. But when the construction starts on the hotel, we will also start construction on 3 of our homes to get those up to code and up to livability, and then we'll transition people around, move them around, and then work from home to home to home. We're currently working with ORF, which is the Office of Rural Housing, Washington State Housing Finance Commission, and Department of Commerce on all of these projects.
That is so exciting.
Hello, I'm Lori Holzmoyer, and I'm a recent volunteer at Rochester High School.
Hi, I'm Allison Waters. I work with Family Support Center. I work in coordinated entry. Thank you.
I'm Mary Rulowitz from Timberland Regional Library. I'm the early learning coordinator there.
I'm Jody Still. I work with the Youth Connection in Shelton. We also have a center in Belfair, and we work with youth 12 to 24.
I'm Selena Rodacker, and I work for Garden Raised Bounty, and I am Grub's part-time admin office person within HR and admin, and then I'm also our alumni and vocational pathways person within our youth programs.
Good morning, everyone. My name is Sarah Little, and I also work with work for Timberland Regional Libraries. My position is Equity, Diversity, and Inclusion Coordinator, and I reside in Aberdeen. I also have an office in Tumwater, but I also telework, so I appreciate hearing all the wonderful things happening within our 5 counties that I get to serve.
Great. Well, this time is for you all to ask questions of each other about wraparound services and what's on your mind as a person concerned about our community. So open it up.
So I guess I'll start. I'm the one who asked the question, can you describe what wraparound services are? I was kind of figuring out in context kind of what it was, but since kind of the focus of all this is mental health and everything, I'm wondering if you guys can, send us some links or send us or talk about ideas that you have for building resilience and building the connections for educating folks about either mindfulness or how getting this information more widely distributed either in school districts or just in the community. Say I noticed that you're having so while you think about that, I noticed you're having Anywhere Library Day in June or July in Rochester, and I'd be willing to put up a flyer at the grocery store and the post office and stuff if you want to, we can get it offline to promote that event. So don't know kind of what other things you do to promote those sort of events, but in the sense of trying to build the community and also just letting people know they're not alone, right? And what, like you guys are talking about, what services are available if they they would like to reach out.
Just put a link in the chat. I'm not sure it's exactly what you're asking about, Lori. I think that you know, this is a link to QPR training, which is a suicide prevention training that we support through Family Education and Support Services. We support it financially, and they do the training. That's a great place to start. Also, mental health first aid training is a little bit more. It's a full day training. It may be something just as far as getting a general level of understanding of mental health and wellness. It's really those trainings are really about helping someone that's maybe needing a referral or is having more of an acute event or episode. But I just wanted to make sure I shared that. And that is anyone in the entire region can sign up for that. It's online. The next training is June 13th. So they happen pretty regularly, and it's been really successful.
Thanks for those resources. Lori, since you're in schools, I'll describe a little bit about wraparound services that we provide. So Together partners with school districts. We have a lot of different funding mechanisms, but we do our wraparound services place-based. So we're connecting with youth at schools, K through alternative schools, so up to 21. Our biggest program is in the Tumwater School District, but we have case managers who are working to connect with youth really to be an advocate and a liaison between all of the different services within a community. Housing, mental health services, just to help families who are already dealing with challenges have somebody to really talk through what services are going to be, best for them, to make plans, I'm personally dealing with trying to get a prescription covered by my insurance, and it's hard. You gotta make yourself a list. How am I going to get through this? Who do I need to call? All of those things. And so really being, that coach and advocate to help families navigate. So that's how we do wraparound services. What I love about wraparound services too is that it's really client-based and person-based and relationship-based, because some of the big systems don't build those, really strong one-to-one relationships with families. And so they end up not getting access or, not having their full humanity and their full dignity taken into account. And so the way Together really works to do that is to build those relationships. And of course, relationships is what helps build resiliency, right? We could tell kids how to build resiliency, all of those things, but it's really those relationships and deep coaching and connection that's really gonna foster that for kids and families. In terms of mental health services, our staff in all of our programs are really looking at how to build community and connection, both with our organization, but between peers and families. So bringing families and students around certain identifying, and for youth, it's youth who are experiencing, anxiety. And so having support group is a reach, but having spaces where kids can really connect around some of the challenges that they're having. Those are, and we're just using connection as a way to have kids and families start, coming back together again and creating a network of support, because that's a really important piece of building resilience.
So you used a word, you said using sedaction, using something to help build, I didn't catch that word.
Connection.
Oh, connection, to build connection. I thought you said we're using, and there was a word that dropped out for me that I thought that it was some other acronym I wasn't familiar with this world. Okay, thank you. Every field has its own acronyms, yeah. school's going to be out pretty soon. So,
Yeah.
yeah. So I'm trying to think maybe about next year and about how do you let people know, maybe they can make an announcement or something about the roof community center, or somebody could do something like this in any community in Washington to say, here's, some posters up in the roof community center that, go on over here, and there's information about the things you might need over the summer.
Yeah, we don't do it for every community, but in the school districts we're working and we put together like a summer resource guide. Also, as a nonprofit, even though we are working in schools, we are open all year round. And so we keep community center open at the schools, so families can drop in. And in the past, we've had Family Sports Center be there. We've for coordinated entry so that families can drop into the school buildings that they already feel connected to and are used to going to and are accessible to them in their communities. So, yeah.
Megan, we used to keep your great brochures where you list all the services. Do you still distribute those?
So we have very few left, and it's an old version. We retired creating that. We get just as much community praise for that as we get frustration from partners, because the minute we produce a printed guide is the minute it's out of date.
Right.
And so there's a couple of online resources that have popped up that we hoped would have taken the place, like Unite Us. So yeah, we direct people to those other resources, but that was a really expensive. It was like $15,000 to $20,000 for us to print the number of guides that we made. So now we do really, really micro community based. Yeah.
Do you have a link that you can put in the chat that for Unite Us or these kind of places that?
Sure can.
Brady, this is Angela from TRL. I have a question about the More Right group. I've not heard of you guys before, and it sounds like you provide case management with your wraparound services. I'm curious about that, and how does one start if they're interested in accessing those resources?
So they can contact us directly. They can. We also work with about 700 different organizations. With Together and Choice as just being, two of those. And those organizations can also refer them directly to us. But when I started almost 3 years ago, it was literally Tanikka and I, but now we have a staff of 17 and we're growing and growing and growing. But yes, you can refer them directly to us. They can come to our door. They can email us at referral, and I'll put it in the chat.
I was looking at your website a little bit, and it looks like you do like some trainings, classes, and resources like that. So is the website really the best place to sort of keep an eye?
That and our Facebook. Our web. Okay. Yes, our website is we do our own website. And we don't always update it when we should. But our Facebook, the More Right group, it's MOOREWRIGHT. It's actually 2 family members. It's not that we're better than anybody else. It's 2 family members that created the organization, and that's where we are now. But yes, we have case managers, we have peer specialists and peer counselors on staff through our recovery cafe and our housing program. Our workforce development program is going to be restarting. We had it running and great before COVID, and then COVID, destroyed everything. So we are going to be reopening our workforce development in logistics and warehousing programs. Training classes, OSHA 10, first aid, CPR, AED, everything that you would need to work in a warehouse. And then the training that goes along with it. We're going to be expanding into a food program as well. culinary arts and food handlers permits and HACCP and all those terminologies. So we do have peers that are case managers that navigate through the FCS process, the Washington Connect, so that we're able to assign people for Social Security, SNAP benefits, medical, anything like that. But it's mostly those peers and our social workers downstairs that are working with those clients in and out every day.
Sorry about the link bomb there, but there are plenty of lists out in the community of resources. So
Thank you. I appreciate it.
Yeah, I was gonna say the same with my role starting in January. I'm really trying to get a huge list of resources and pathways and things for our youth. And so the more that I learn about other organizations doing specific things that we don't do and or things that we can let our youth know and our alumni know through our Facebook and all of those kinds of things, events that people are putting on in the community and so on and so forth. The more that we can connect our youth with the community resources. Yeah.
what other questions or musings do you all have?
You know, we have so many library folks on. I'd love to ask a question about your perspective on how libraries can, you know, where libraries are going, how they're going to play a part in this. For me, I think of a social care network that we want to build in the coming years, and being that trusted in community location is such prime real estate for transformative operations for all of us. Can you guys talk a little bit about how you see libraries playing a part in that?
Well, it's interesting that you spoke up, because I was just about to tell you, I was very moved by what you said earlier, you know, about cities designing blue zones because human connection is so important right now. And I'm thinking, libraries, we're blue zones. We're already blue zones. You know, we're a place where community members can come and connect, whether they're coming in to check out a book and they run into a neighbor, or they run into someone who looks familiar, or they're coming to a library program where they're really connecting around, you know, a speaker or an event. So, or our story times, our early learning programs, where parents who are moms and caregivers, dads who are really isolated, can come together and connect and have some human contact. So I've just been thinking about that since I heard you talk about blue zones. Yeah, so I appreciate that. But yeah, we are focusing a lot on outreach and getting out into communities. Our Anywhere service is about to launch, and hopefully eventually we'll have services reaching out to all of the areas in our 5 counties. But I believe the buildings are still really, really important, and what we offer inside the branches for that important human connection. So yeah, we have a very robust website. I think Sarah's putting some links in for our various events. But, you know, with 5 counties and most of them rural counties, our reach is pretty wide. But we have seen that even in the outer areas, in those rural communities, we're not getting to people. So that's our kind of has been our focus lately. So we're trying to do everything for everybody, but I love hearing about all these services, though. It sort of makes my head spin, all the amazing work that you all are doing out there. And we're always trying to find a place where we can insert ourselves and help with these efforts. So it's really nice to hear about what you all are doing, and yeah, keep us in mind, reach out.
Thanks, Mary. I shared a little bit in the last breakout group. I'll share here too, figuring out kind of how all of these services can be understood and feel accessible to each other and to the medical community who is at that moment where they see somebody in the emergency room with all these needs that they can see are going to drive health outcomes better than the prescription or that aftercare visit summary is able to do. How can we make them feel accessible and have a pathway to get that service and to see that it happened securely with all of the rules we have? Our community services lists are great, but how can we kind of pull all of those together? And there's a technology piece to this, which is also moving at the speed of light now. And we think about, okay, that's going to be part of the solution, but we've got local forums in each of the 7 counties we serve. We've done a really big inventory with them in the last few months. We're going to be talking about priorities and hopefully building that community information exchange is what it's called right now throughout the state of Washington. And that would be the place where the funds could flow as well as the information to drive services, drive funding into communities to do the preventative work, the social determinant of health work, that so many like the exciting things we're hearing about from folks. So we're not going to be a direct service provider. We're hoping to build that hub that can illuminate those pathways and make it easy for funds to go there to help CBOs. But that's going to be a community-wide effort. It's not ours. I heard someone say it earlier. This is building with, not knowing how and giving to, or building for. It's building with. So we're a community-governed organization, and I just hope that we can all have that someday. And as a social worker by trade, having done a lot of discharge planning in jails, in hospitals, in working with youth and families, I just know that resource, once it's up and running, is so critical. So that's where we're hoping to go. And this is a great room for me to share that with and just learn from. Selena, could you tell me more about Grub? I used to drive past it here in the west side of Olympia. And I just think when I think about blue zones and people accessing healthy food and how do we connect all of that with social justice? I know that's kind of the space, but could you tell me more?
Sure. Okay. So there's a lot to tell you, and I'm not sure where to start. So we offer 5 different programs, and one of the programs that we offer is within our Wild Foods and Medicines department, so we work with tribal communities and K-12 educators to implement social and emotional learning curriculum within the Northwestern school districts and the Olympia school districts and the Native communities. And then we also do a backyard garden program. So we work with low-income families and provide free backyard gardens. Every year we do about 30 to 50 of them. The application process starts in January, and it's given to we just finished up our gardens for this year. And then we also do community gardens on an application base. And then we do a program that Megan is a little bit familiar with, is Grounded. We have a partnership with Gravity, where we work with youth that are earning their GEDs. And we have 3 different cohorts throughout the year where they stay on our farm for 10 weeks and they learn the farming process and how to basically public speak and so many other various topics. And they earn a stipend while they're here with us, as well as they work on their GED. And that program is an evolution, because it used to be a different program where we would work with the school districts, and we were working with Olympia High School and Capitol High School and a couple others. So that's 3 of the programs. And then we also have like the whole volunteer CCL cultivation program, where we offer trainings to people in the community and offer volunteering events and abilities like on our site and broadly let's see what else. We have a veteran program, so we are working with people to get B certifications, veterans that are coming out of the service, that are getting ready to enter back into the civilian world. And that program is very much evolving right now. And we have a new program that just came, and it's called Growing Home, and it's based out of African American history, Black history, and it is currently a small group where they meet here monthly, and they grow foods within the backgrounds and involve other people, and just a space for, because there's not that many spaces in the community where those kinds of folks can come and convene. We have a 2-acre farm, so that's part of where that grounded comes into play. What else? There's a lot. I can give you guys my website, our website, and there's lots of ways you can engage. We have lots of free events that we do on our website, and webinars. And then we also have a lot of like trainings that people can attend to. So, and actually one of them is happening right now, which is our institute this week, where we're teaching our ground ed model to other people in the community that want to implement our model and bring it back to their communities. So let me share that. Did I answer your question? Okay. And there's lots of ways you could get in our newsletter and lots of different other things that you can do to stay engaged and involved if you would like.
So we're always trying to be like, how can we do it? You know, you can't reach everyone, but things like this are really great for us to see and make sure that we're reaching as many people as possible.
Yeah, and I think that's one of the reasons that the birth to 5 age group is part of our strategic direction at Timberland, is because we recognize the library's role in early learning as just like part of the fabric of what families have to access. And so I know Timberland really does recognize that. And I feel like I read some service story somewhere that was posted, or an email or something, that said it was a parent saying that they specifically said they could not afford preschool, and so they hopped around to different libraries different days of the week to go to all the story times, and that was like how they were doing their preschool, which
that's how you do it though.
Yeah.
You do. You find all the free resources.
Also kind of sad because our programs are, I'm gonna say they're great, they really are very good, but they're also not a full on preschool curriculum, so that, yeah, it's kind of a plus, and also like, okay, but it's it's still not actually preschool.
Yeah, it doesn't provide everything, it doesn't, necessarily provide like that break from parents. It's not all the time, all the same, there's going to be gaps in there, but at least it is something. And like Jessica, it sounds like that really resonates with you, and the folks that like that's kind of, and I did that before I started working at the library. I was coming here with my daughter going to story time, when I was staying at home and wasn't working outside the home and didn't have any other resources to meet other parents or for my child to get socialization. This is pre-pandemic, right?
That's what I was just gonna say, is that socializing piece. If anything, your kids are just interacting with other kids, regardless of what the content is or what they're doing. So
yeah,
especially pandemic, this kind of, I don't want to say post, but whatever version of the pandemic we're living in right now, it's really important.
Yeah, and I think the other aspect is that if you can, like, yes, our programs are for our preschool age kids, but they're also for kids that are even younger. So it's like you're kind of building that up.
Yeah, like we've got things for like babies, brand new babies, and yeah, it's definitely, and then just even play groups and just, you know, you can have it more structured, less structured, more of that socialization piece. And I know in our buildings, we're trying to create even more like just physical space that encourages sort of socialization and community kind of connection. I know that was a question to the panelists early on today. And I think even those little small moments, those sort of passive kind of spaces can be really key as we kind of start socializing more and connecting communities together a little bit more. Because everyone can come to the library, right? Can be hard. Karen,
I'm curious.
Oh,
I'm sorry.
no, please go.
I was just gonna ask, I'm just kind of curious what your previous session with those folks kind of chatted with y'all about, and if there were any little nuggets of good conversation. Since it is just me and y'all know each other and
It was just us the last session. We were just talking to each other.
Yeah,
might be a recording.
I think it's recorded, and I think you can learn more about both of our programs and how we're free to partner in the future.
Yeah, we were talking about the ways that we can collaborate and the different things that you know my program does, our goals and all of that stuff. Some of the things that we came to this meeting prepared to talk about, and you know how that relates to our program. So specifically, I came to talk about Latinx access in STEM, especially like STEM studies in post-secondary, but also STEM careers, and how to re-engage or better engage, I should say, Latinx populations. And so I think that's a lot of what we talked about. If that captured a lot of it. Yeah, we were a lot of what we were talking about is ways to collaborate and things that we've seen in the community. And so yeah, that's why we're like, hey, our questions, you got questions. We love questions.
Yeah, that's funny.
Yeah, definitely. Well, my question I was gonna ask is like, what were both Karen and Jessica, what were your previous sessions like? Where did you go? Because I want to know how. I love this breakout room kind of format. It's so cool, but I know I was interested in a lot of the other topics and how like the topics Riva and I were talking about relate to all the other ones as well. Does that make sense?
Mm-hmm. Yeah, Samantha was talking about one of her previous supervisors talked a lot about getting off your island. So, you know, if your island is what you're doing in your own world, it's important to get off your island and go and meet with and chat with other people working, which is, you know, this entire webinar, right? But I can see how, you know, if you're moderating a room, you're just like, but I want to know what everyone else is talking about. So that one was the Justice Impacted Youth room. So a lot of, you know, she works with Monarch and justice advocacy for sexual assault cases, and she's an interviewer for children. So talking a lot about that system and kind of holistically just thinking that as a community, we need to rebuild trust and kind of go back to the basics of connecting with youth. A lot of what she's seen within the pandemic is that children are just not able to communicate in a way. And there was another woman from the library who was, you know, really engaged in wanting to figure out, you know, what kind of events to have, or even wanted her to come and speak to the library because she does a presentation on technology addiction and this idea that our kids are kind of zombies, like we don't know how to talk in person, but we're able to, you know, be on our technology and engage in that way. And so it's really interesting to hear our folks kind of talk in that way around those themes. So it's my session.
Yeah, that sounds really interesting. I was definitely interested in that session as well, Jessica. I was like, oh, I'm gonna watch that recording later. Yeah, that's a good one. Karen, what do you mind if I ask you what session you went to before?
Yeah, I went to the STEM career readiness one. In which, you know, was interesting. A lot of it was just kind of general, talking about there were some different agencies and how they were helping support students with career readiness / STEM in different ways. And oddly enough, the cell phone thing came up in our break room as well. So I think just it was something that was brought up by, you know, a participant. It wasn't like a scheduled topic. It's something that we should be discussing, but that's just funny that it came up in both of our sessions as like an acknowledgement that we probably all spend too much time on our phones, and that can't be a good thing. Definitely a good thing for teens. Do all the time, so it's funny. Yeah, I think one of the things that I took from it is they keep up on the Washington State Opportunity Scholarship, and those are like, I mean, I need to look into it a little bit more, but basically they have all these scholarships that are available for, Riva, you know of it then probably, because that's kind of in your line of work. Yeah.
Yeah, my students get it every year.
Yeah.
No, I was gonna say, I feel like you should have been in the other one.
Yeah, but it seemed like, oh, like, okay, that seems like a good scholarship to promote for it was like low income students and also like going into STEM careers specifically. So yeah.
Is that
Yeah.
one of the
Oh, go
scholarships
ahead.
you were speaking of earlier, Riva, that you're able to get for students and then following through on that sometimes is a challenge?
No, actually, I have tuition waivers from Evergreen, and so I can give them waivers or split up waivers. If they have financial aid, like the Washington College grant or something like that, it's better if I split up the waivers, so I can serve more
Oh,
students.
cool.
So yeah, I can give them those scholarships. And there were a couple years where, because the Washington College grant has so much money, I didn't have to actually give out any of my awards except for to WASPA students. And so yeah, it makes a difference when I can. But the Washington State Opportunity Scholarship, we definitely have students getting that pretty consistently. It seems like it's actually not, I don't want to say not difficult to get, because they do have to put in some work, but we do have students getting it all the time. And yeah, our students are pretty well represented. I'm pretty sure the last 3 years, the students who got that scholarship were all Latinas with our
Oh,
program.
great.
Yeah, so yeah, it's a pretty cool opportunity. There's also the College Bound Scholarship, which they sign up for in 8th grade. They often don't know that they have that when they go into college, and the college sometimes doesn't even tell them. It's just in their awards. So that's something that if we're able to get College Bound to talk to kids for the Latinx Youth Summit, that would be a great organization. That I think it's College Success Foundation.
I know, I think 2 years ago they were there, and then I think last year I wasn't able to get in touch with them, so I'm gonna put them at the top of my priority list.
They had a staff change. That might be why.
Okay, that's probably why. So maybe I'll connect with you and get the current contact, because that happened.
Yeah, we'll see if I can find
I
her.
lost so many people during the pandemic, which I know we all did. Not just professionally, but just losing contact with folks. Yeah, that's amazing that kids are funneled into that and then don't even know that they're still have that.
And it takes a huge chunk off of their tuition too, if not covers their tuition, depending on where they go. And so it's really great if they can just maintain the GPA. And there's also the WUI schools, you know, the Western University Exchange schools, where if they can maintain a certain GPA, they can get reduced tuition for out-of-state schools, including those in like Hawaii and I think Alaska as well. There's lots of opportunities for funding. I think we were talking about this in the last session. There's opportunities for funding. It's the other pieces that go with it that cause them either to not to take advantage of the funding, or don't see a point in taking advantage of the funding to go. And so yeah, and actually I need to take my son to those story times, because I feel like starting early with that confidence building is going to be key. And especially if we're able to find a way to do that in STEM, like take my husband STEM is his thing. So I'm sure that he'll find a way to engage him in STEM. But I want to find ways to engage with other children in STEM. And it sounds like you guys might have some opportunities in that area too. For the high schoolers, I don't know if you've ever heard of Math Motivators before. They are, I believe they're a nonprofit. I have no idea where they're located. I can probably get you the contact for Math Motivators, but they're going into high schools and they're trying to build partnerships with the schools and nonprofits and organizations to motivate students in, increasing their math skills and stuff like that. And they'll work with like middle school, I think, through high school students. And they work with volunteers and all that stuff, and they do virtual and in-person stuff. So I'm wondering if you guys want to get in touch with them and see if there's a way to build a partnership. They'll do curriculum on curriculum on financial literacy. They'll do like SAT, ACT prep, stuff like that.
Okay, Jessica, I'll try to send a different one. I thought I did it right, but I tried to upload it, so I'll try it again. Thank you. I can also email it to you too. Yeah, that sounds great, Riva. I'll definitely look into them, because we're always thinking about that age group too, because if we don't get them in that 0 to 6, as Carl was saying, that is our strategic direction, but we want to make sure we also follow our youth through their process, right? Like that is part of our strategic direction because it's foundational, but that doesn't mean we're done once they turn 7, right? There's like, that's just us starting, and we want to make sure we follow them through. And we talked about that a lot, I think, in the last session, is that follow through the end.
Yeah.
And, I guess I had a question for you, Riva, too. Like, how do students, like, so do you start with students like in high school? How do they kind of get connected with your program? Like, what does that kind of pathway look like?
So it's complicated because we're a federal grant program. You have to be eligible. So you have to demonstrate that you're low income. You have to demonstrate that you are either low income or the first in your family to go to college, which means checking a box and maybe entering some tax information. It is limited because it's a federal program. You have to be either a citizen or a permanent resident, or have documentation from INS that shows that you're in the process of gaining permanent residency. So it has to be that letter that says that you're beyond the just entering the country portion. So it is in a lot of ways inaccessible to some students. That said, my staff, it's not like they're like, no, go away. They're serving all the students. We just can't spend the money on them. So we intake students through an application process. So we reach out to them. We ask about grade point average. We try to take students in who are have an actual plan to go to college. And so we try to get students with a 2.5 GPA or higher. Although if they're at risk of academic failure and they have a real solid plan to go to college, but they need the support, we can still admit them. And we try to get them earlier. The more years they spend in our program, the more of an impact it has, the more success we see in the end. Junior year and later, sometimes they're just taking advantage of our college application and scholarship support. And that ends up just being kind of getting them in the door, but not giving them the skills that we work on with the first couple of years that focuses on their identity, their culture, the assets that they bring with them to the campus. That, if you are like me and you speak with your hands, some people who are from other cultures don't necessarily think that that's very, they might think it's rude or something like that, but it helps me get my ideas across. And it's an asset for me to be able to do that I bring to campus. That's an example of like a cultural asset that I see students kind of feeling bad about, or maybe having an accent or knowing a second language really well. they'll feel bad about that because they're bringing that to a campus and it shows that they're different. No, they have more skills than the next students. They're bringing something with them. So we need to work with them to build the asset mindset early. And then when we get them enrolled into college, sending them out into other resources like TRIO programs, multicultural offices and stuff like that, so they stay retained. So yeah, it's a pretty rigorous application process. We do ask for an essay. That said, we spend $5,000 a year on each student, about $5,000 a year on each student, trying to get them the skills and everything that they need to go to college. So we'll do college visits, we do service learning projects. So we may reach out to you to do some kind of service learning project in the future. We have people come in to talk about careers. We'll take students to cultural events. That's a big one that we really like to expose students to different cultures and help build cultural aptitude, not just cultural humility, but cultural aptitude, so that they understand other cultures and recognize that differences can be assets, right? And so those are some of the goals, but we have 6 objectives we try to accomplish when students come into our program. And so we'll check up on whether or not they have a 2.5 GPA, they go on to the next grade level or graduate on time, they're taking the classes they need to take to get into college or challenging classes. They are passing all of their state standards. They are enrolling in college the fall term immediately after high school graduation, and they are graduating within 6 years. So I know that's a big mouthful. We have a little bit of time left,
No, that's
but
good.
yeah, because we're a federal
them-
program, there's a lot of accountability. So
Yeah. Do you help them through that like FOSFA process and everything too? You provide a lot of support for that?
yeah, and actually this last year we brought students from all 3 of the Shelton schools, the Shelton High School, so like Choice High School, Cedar High School, and Shelton High School, all to Evergreen, not just Upward Bound students. And we gave them tours of the campus, we fed them lunch, we helped them with their FAFSA, we taught them what the FAFSA process looks like and what it means. These were seniors that we brought. We gave them application workshops in case they wanted to work on the Evergreen application and submit that. And we had college and professional panels. So we had people come from the community and from the college or colleges in the area. I believe we had some students from St. Martin's as well come and talk.
They're great.
So yeah, we got a lot done. And we also, I think, talked about scholarships, and we do something like that annually. That was the first year that we did a big thing. And I think I'd like to do that again next year.
Yeah, that sounds really good.
We have a YouTube channel with all of that information in multiple languages too. I worked with Lori on this actually.
Oh,
So the
cool.
Upward Bound 360 YouTube channel it has videos in Mom, Spanish, and English about how to complete the FAFSA, what that process looks like and what it means. And then we have everything on that channel, from what to do if you're a student and you get pulled over, to how to do some dorm room cooking, to some sample lectures and stuff like that.
I feel like that's definitely, Karen, that's definitely like a resource we could share for sure. I'm like, because I get questions about that kind of stuff all the time, and just to know that it's already available.
I need to let Kendra know I have it in Mom and Spanish. I don't think she knew I had it in Mom.
And having it in Mom is so amazing, because I know Kayla's always like, do you have anything? I'm like, no. It's like, I know in the future that's something to work on. Yeah.
The only thing that's kind of a drawback is that and I don't think it's necessarily a drawback in general. It's just kind of a drawback that we can't get it in writing, because Mom is not really
writing
based language so much. So we don't have like a closed caption or any kind of presentation to go with the Mom one, but it's there and it does give the information. And there's also a Spanish video with some language with it that actually can contextualize a lot of what's in the Mom video.
Yeah, you should definitely, because I know in the beginning, and Jessica, I sent that link again, but I'll send it. I'm going to send everything to Lori, because I have also this great sheet that Karen actually created for our My TRL program, which every student in almost every school district across the Timberland district has a free well, all library cards are free, but they're automatically get a library card, which is called a MyTRL, which gives them access to all of our digital resources and so many things. They don't even have to apply for it. They just get it. So there's so many things. So I'll send all that, and I got your email here, and then you should send that YouTube link or remind Lori so she puts it on the thing she's going to send to everybody, you know?
You'll have to do that. The channel is Upward Bound 360.
Okay,
So
got
if you're
it.
ever browsing on there, but I'll make sure that Lori sends it out.
Great.
I want to start off by saying thank you to all of our panelists today, and to Commissioner Mejia, and to Lori, and to Timberland staff as well, because we've all done, it's taken a village to put this event on. Please remember that this will be shared out with on many different platforms moving forward. This is the first one of many to come. The second will be November 2nd, which I believe is a Thursday. And we're probably going to start it at 5 because we would like to have people who work during the day attend that session. And we're still figuring out, what the theme will be and soliciting feedback, et cetera, et cetera. So more to come on the moving forward part 2 or step 2. I do want to take a moment to use my platform right now to talk about how public libraries bring hope and resilience to our communities. We have 29 libraries across 7,000 square miles. And that includes Lewis, Thurston, Mason, Grace Harbor, and Pacific counties. One of the 4 top items I want to talk to you briefly about right now is first, the summer library program, June 1st to August 31st for families of all ages, programs galore at our libraries and with our partners. And along with that summer library program are story trails. So as JP said earlier today about Blue Zones, story trails with deconstructed picture books that families can walk along, read, and enjoy nature. The second topic is the library card contest. So we have a library card contest starting June 1st to July 15 for children ages 18 and under. We're going to pick 3 winners, and from there, create library cards for Library Card Sign Up Month this September. So we're very excited about that. Please get the word out. It's also will be available, more information will be available at trl.org. The third thing I want to mention is that we are in partnership with the Child Care Action Council for Thurston and Mason counties. We are in partnership with Lewis County United Way for Lewis County, and with Grace Harbor United Way for Grace Harbor and Pacific County for the Dolly Parton Imagination Library. This is a sign-up program where a child birth to 5 will receive a free book from the Dolly Parton Foundation. We know that there's a little bit over 29,000 children in our 5-county region, and we would love to see more, as many children signed up for this. So you can go to each one of the organizations I just mentioned website to sign up your child. You can go to trl.org if you so wish to sign up your child. And you can also go to the Dolly Parton Imagination Library, Washington State page as well to do that. And it's going to take us as a community to get as many children signed up for that program. And then lastly, I wanted to mention that we are going back to the past, into the future, but back to the past. And that is, we are reintroducing mobile services after a 40-year hiatus. And so we are looking at, by the end of this year, having library staff going out to really remote locations, anywhere between 16 and 32 locations per county. We are working on this right now. We have a kickoff in South Thurston County on June 21st at 10:30 a.m. at Rainier Senior Community Center. These trucks or these vans will be all outfitted with superior Wi-Fi hotspot, whatever technology, so that we can get the access to people, remote printers, et cetera, et cetera. So that's my soapbox about resiliency and hope coming from Timberland Regional Library. Any final comments from anyone? I know there were some comments coming in as I was speaking, but I had to concentrate on what I was saying.
Cheryl, I just would say first, thanks Moriah for co-facilitating with me and those who joined us. one of the common themes in both discussions was the need for one place to go to find resources for families. Where's the free resource? What are we going to do today? What if I'm stressed? What, you know, all that stuff. And some kind of liquid document that anybody could get to that was accurate in the community. So some more work to be done.
Good to know. Thank you. Any other final comments before thank you. This was great information and connections. Awesome. This is exactly what we intended it to be for the first one. We've learned a lot. The second one will be even better. Thank you so much for coming. We're ending a little bit early. And please, when you will receive hopefully the links to the different segments and send them out and share them out with as many people as possible. Thank you so much, and hopefully we'll see you in November.